in the paradigms in Japan testing, but now the video that has been accessed by the public, but clearly shows that
No, ma'am.
Good morning. Good morning. Am I audible?
Yes, sir. Good morning, sir.
Thank you. I'm going to share my screen. So please let me know if my screen is visible.
Yes, sir.
Is my is my slide visible?
Yes, sir.
Yes, sir.
Okay. Is my slide changing?
Yes, sir.
Thank you. So kind of you. So happy morning. Today we are going to deal about engineering hazards. Before that, we will see what is a hazard. A hazard is anything with the potential to cause harm. A risk assessment needs to recognize the likeliness and severity of the hazard to do harm, which leads to be the precautions to take to minimize the risk. Long back, when I was associated with the JIPMA, the contamination post-surgery was very high. This was a hazard. To contain the contamination, many steps were taken. The cleaning procedures were changed, but there was resistance from the sweepers. To overcome that resistance, the director of JIPMER then, one fine morning, walked into the post-surgery ward. He called the person who was sweeping and told him that his method of sweeping was not correct. He took the mop from his hand and he taught him how to sweep. Next, he entered into the washroom and he found that the washroom was not clean. He called the sweeper, showed him the washroom, and then he asked him to go out, close the door, and then he cleaned the washroom himself. And then again he called the sweeper and showed him how clean the washroom was. Finally, he called all the sweepers and said, in case if one of your very near and dear relative, could be your mother, could be your father, could be your wife, could be your daughter, if they are admitted in this hospital and if they have to undergo a surgery, and post-surgery if they are having a problem, an infection, then there is a threat to their life. So in case if your dear near relative is admitted here, how clean you will be keeping the place? So please treat each and every patient here as your near relative and clean this place accordingly. So this speech of the director had a great impact on the sweepers, and the sweepers immediately joined hands and they cleaned the hospital premises and maintained it so clean that the contamination level came down. So this is risk assessment, and this is a hazard. So in your examination, in case if there is a question on hazard, we will go into the classification of hazards. There are 4 basic classification of hazards: chemical, physical, biological, and ergonomic. But now this electrical hazard has also added. So though initially electrical hazard was a part of the physical hazard, now it is a major component. So there are 5 major types of hazards: physical, chemical, biological, electrical, and ergonomic hazards. So there are 5 major types of hazards. What is what is hazard engineering? If you look into a syllabus, it is called as engineering hazard. Hazard engineering and engineering hazard are both the same. Hazard engineering is concerned with the identification and the treatment of exceptional circumstances where the hazards need to be controlled using specialized skills. Hazard engineering is nothing but troubleshooting. You will have to identify where the trouble is and you will have to shoot the trouble. So such troubleshooting is called as engineering hazard or hazard engineering. Now we will see what is a hazard control program. A control program consists of all the steps necessary to protect workers from exposure to the substance or a system, and the procedure required to monitor worker exposure and their health to hazards such as chemicals, materials, or substances, or other types such as noise and vibration. In the kitchen of one hospital, there were too many cockroaches. To contain the cockroaches, they started spraying with the insecticide. That insecticide caused allergy to the cooks who were in the kitchen. So this is a hazard. Now, it was identified that it is the insecticide that caused this allergic reaction. That insecticide was stopped, the cooks were treated, new cooks were appointed, and the entire kitchen was closed down. It was cleaned, disinfected, and again there was a policy that henceforth such insecticides should not be used to contain cockroaches. Other edible insecticides should be used. Now, we will see the different types of hazard one by one. Already the types of hazards we have seen. Now we will see what is the cause of hazard. The major cause of hazard is machinery malfunction. An AC duct could be malfunctioning. An electrical equipment leakage might generate heat and there could be a fire. Chemical contacts, slip and fall while handling and transporting. So if the floor is very slippery, the chances of slip and fall is more. Excessive heights, failure to report breakage. Somebody is carrying a glass container and the container slips and falls and breaks. Everywhere there is glass pieces. And immediately if those glass pieces are not removed, then it will become a hazard. Failure to follow instructions. In one hospital, there is an in-way and there is an out-way. One emergency ambulance entered through the outway and there was an accident. This accident was so major that many people were injured. So had they followed the instruction, this hazard could have been avoided. Now, when there is an hazard, we will have to manage the hazard. This is one of the skills of the hospital manager. So how to manage a hazard? Very simple. First, assess risk. Next, minimize hazard. Third, control hazard. Fourth, prevent hazard. Fifth, monitor and review hazard. Okay, so these 5 are the risk management techniques that are required in hazard management. So we will see each and every one of them. How to assess risk. So there is a present system of operation. If you take a hospital, there is a security system. There is a patient registration system. There is a cleaning system. There is a workers attendance system. So in each and every system, you need to assess what is the possible risk. Now, once you assess the risk, then you will have to assess the threat. Suppose there is a security system. The security system, especially in the newborn ward, is very, very important. Of late, you might have seen in the newspapers that newborn children are being stolen. So this is assessing the threat. This is identifying the threat. This is characterizing the threat. This is assessing the vulnerability of the critical assets to specific threat. Now, to overcome this, what should we do? We should install CCTV cameras. All the newborn babies and their mother should have what you call a bar-coded tag, identification tag. And the security in the entrance should be trained in identifying the mother and the daughter. So this and all are implementing temporary measures, and slowly these measures can be improved until it becomes permanent. And practicably, it should be implementable. So assessing the risk is very important. Determining what is the risk, evaluating, selecting the temporary and permanent controls, these and all comes under assessing the risk. The next aim of a hospital manager is to minimize the hazard. So how to minimize the hazard? Hazards can be minimized. For that, you will have to identify the viable, practicable solutions. Identify the ways to reduce those risks. Prioritize the risk reduction measures based on a strategy. So what to do first? Prioritization. One technique is to isolate the hazard. Once the hazard is isolated, then stop the work activities. Comply with instructions. Ensure safe access. Use guards. Use fume extraction. Use personal protection equipment. Incidents report to supervisor, and then consultation. These and all are the methods to minimize hazard. Suppose if there is a highly infectious patient and the patient runs away from the hospital without any information, en route, he will be passing on the infection to many people. So it would become contagious. So here we will have to identify the ways to reduce this risk. First, we will have to prioritize, like in which ward he was, and we will have to find out the route in which the patient escaped, and en route, whom all could have been in contact with him, we should isolate them, and we should give clear instructions like how to contain the infection, and the people who are in the process of sanitation should be given guards, personal protection equipment. The incident should be reported, and to avoid recurrence, we should find out why the patient ran away. We should try to retrieve the patient, give him psychological counseling and treatment. So these and all are the methods to minimize hazards. Now, how to prevent hazards? So hazards can be prevented by providing adequate personal protection. In many places, the lighting is insufficient because there is centralized air conditioning system, and the entire building is dependent on artificial lighting. And if there is a power failure, if the electrical connections are not properly maintained, then there is lack of adequate lighting, which will become an hazard. In most of the hospitals, if the maintenance is not proper, the stop-start switch would not function properly. In many old hospitals, for the new incumbents, operating instructions would not be clear. The safety information would not be properly displayed. Safety officers would not be on roll. So these and all are the methods to prevent hazards. Each and everyone in the hospital should be trained in preventing hazards. This should be a regular continuing education program on preventing hazards. How to control hazard? First, identify what the hazard is. Then you will have to administer control. You will have to eliminate the cause of the hazard. You will have to provide personal protection equipment to the people who are fighting the hazard. And then you will have to come out with temporary and permanent solutions, engineering control for the hazard. How to control hazard? First step is elimination. Remove the hazard from the workplace. If suddenly there is a fire, put off the fire. That is the first prioritization. Next, contain the smoke that is coming out from the fire. See that the fire doesn't spread. So the engineering control should include designs or modifications to the plant, to the equipment, to the ventilating system and the process that reduce the source of exposure. So engineering design is very, very important. Administrative control controls that alter the way the work is done. So the line of communication, the line of responsibility, including timing of work. So usually in the early morning, the number of people who are at work will be very less. So at that time, in case if there is a hazard, the people who are going to fight against the hazard will be very less in number. So here the policy should change. Seniors should be available in all the shifts. Standard operating procedure, including training, housekeeping, equipment maintenance, personal hygiene practices. They all should be continuously trained. Personal protective equipment, equipment worn by the individuals to reduce exposure such as contact with chemicals or exposure to noise. If there is an instrument that creates a lot of noise, the person who is handling that instrument should be given proper earplugs. So these and all are the methods to control hazard. There was a septic tank in a hospital which started emitting bad odor. And this odor was so nauseating that many workers vomited. So here, the controls are usually placed at the source. So from the septic tank, how did that bad odor come out? So first you have to identify the source. And how did the air travel? Air path. And who were all the people affected? So now the source, the septic tank will have to be regularly cleaned. There must be no escape of air from the septic tank. The air path must be monitored. And the workers should not be exposed to such hazards in future. So all steps for prevention has to be taken. So here, the engineering controls, isolation, ventilation, and process. So these three overlap one another. Engineering controls are methods that are built into the design of a plant, equipment, or process to minimize the hazard. Engineering controls are a very reliable way to control worker exposure as long as the controls are designed, used, and maintained properly. The basic types of engineering controls are process controls, isolation of source, and ventilation. Process control involves changing the way a job, activity, or process is done to reduce the risk. Monitoring should be done before as well as after the change is implemented to make sure that the changes did result in lowering exposure. So these examples that are given for process control are very, very important. Please note them. Number one, whenever there is a drilling or grinding, always we should use a wet method. We should never use a dry method. In case for drilling or grinding, if we use a dry method, then the dust will be more. this dust could cause any type of allergy. In case if it is a wet method, that means when they are drilling or grinding, if they are spraying water over the dusty surface, the dust levels come down. The materials are mixed with water to prevent dust from being created. Use an appropriate vacuum or wet method instead of dry sweeping to control dust and reduce the inhalation hazard. In a hospital, the sweepers who sweep the road, so if they sweep it by a dry method, then you can see the dust coming out. So that would cause a lot of allergy and infection to the patients and their attenders. So if it is a wet method, so first they wet the surface and then they use vacuum to clean, then this hazard can be overcome. Use automation. The less workers have to handle or use the material, the less potential there is for exposure. As far as possible, mechanize all the transportation rather than using the manual method. So, in engineering hazard, isolation is very important. Whichever is responsible for the hazard, in case if it is a chemical, so isolation is very important. If in case if it is a worker, isolation is very important. An enclosure keeps a selected hazard physically away from the worker. Enclosed equipment is tightly sealed and only opened for cleaning or maintenance. Isolation keeps the hazardous process away from majority of the workers. Common isolation techniques that are used to create a contamination-free booth around the equipment. So any equipment that is at a risk of giving hazard has to be isolated. Ventilation is very, very important. Nowadays, everybody is addicted to air conditioning. So in a hospital, when there are many patients in one room, and if that room is air conditioned, then the chances of the infection spreading from one person to another person are more. Ventilation is a method of control that helps in exchange of fresh air in place of contaminated air in the work environment. Ventilation can dilute ventilation can dilute an air contamination below effective level if designed properly. Local exhaust ventilation is very good and can be adapted to almost all chemicals and operations. It removes the contamination from the work environment so it cannot disperse into the workspace. So ventilation is very, very important, and the engineering design of ventilation is very, very important. As far as possible, fresh air, fresh natural air, natural lighting is required. Now we will see what are the administrative controls. Administrative controls limit workers' exposure by scheduling shorter work times in contaminated areas. In case if there is a contaminated area, if a worker is there to contain the contamination, though his working time has to be reduced so that his exposure to the contamination is less. Scheduling maintenance and other high exposure operations for times when few workers are present. So usually the maintenance work, the cleaning work, they are all done on Sundays or in the night shift when the number of workers are less. Using job rotation schedules that limit the amount of time an individual work is exposed to a substance. During COVID, the hospital sweepers, instead of 8-hour schedule, they had a 4-hour schedule. So their exposure was brought to a minimum. Strengthening of natural policies for health at work and development of policy tools. developing healthy working environment, developing healthy work practices and promoting health at work, periodic medical examination and immunization. So periodic medical examination is very important, especially in case if there is a infectious ward. The sweepers in that ward will have to be screened. If there is a TB ward, the workers of the TB ward will have to be screened for TB. Immunization. Immunization is very important, especially during COVID. All the health workers, they were first immunized. What are all the work practices? Work practices are also a form of administrative control. Safe work practices are very important. We will see some examples. Developing and implementing standard operating procedures. In a hospital, there could be a lot of instruments. Like for example, if there is a color Doppler. So in front of that instrument, on the wall, there would be a flex board which explains the standard operating procedure for the color Doppler. This standard operating procedure will be written by a qualified technician. It will be corrected and approved by an approving authority, and then it will be again verified and implemented by an implementing authority. So if you can look into an SOP written by, verified by, approved by, there will be 3 signatures. So such standard operating procedures of the sophisticated instruments in a hospital is very, very important. So they maintain the life of the instrument. Training and education of employees about the operating procedure as well as other necessary workplace training. This is a continuing education program. Establishing and maintaining good housekeeping program. Keeping equipment well maintained. Preparing and training for emergency response for incidences such as spills, fire, or employee injury. Adjustment of man and machine is called as ergonomics. Application of human biological sciences with engineering science to achieve optimum mutual adjustment of man and his work. The benefit being measured in terms of human efficiency and well-being. Education and training is very, very important. Employee education and on-mission training on how to conduct their work safely helps to minimize the risk of exposure and is a critical element of any complete workplace health and safety program. Training must cover not only how to do the job safely, but it also must ensure that the worker understands the hazards of the job. It must also provide them with information on how to protect themselves and co-workers. So most of the time, the sweepers in a hospital, they are uneducated. So they would not know what is contamination. So we need to train them and provide them the basic fundamental knowledge on what is contamination, how to contain it, what will happen if it is not contained, how to personally protect oneself from contamination. So all this is very, very important. Good housekeeping helps to prevent the accumulation of hazardous or toxic materials. Regular sweeping, wet mopping of the area. Once a week, the workplace has to be washed properly. So personal care. So all the people who are working in a hospital will have to be trained on how to take care of themselves. how to use the personal protective equipment as per the need of the work and environment. During COVID, all the workers in a hospital were provided with the personal protective equipment, PPE. But wearing it was very difficult. So there was two small rooms, one for male and another for female, for dress changing and wearing the personal protective equipment. So that room was so small, did not have an AC, it was very hot, and too many people crowding in one area for dress changing was itself a hazard. And they will have to wear this personal protective equipment for minimum 4 to 6 hours. So they were all, and AC was not permitted at the time. So AC was not permitted at that time, and hence they were perspiring. So this perspiration led to skin allergy. So to overcome that, the doctors themselves came out with a beautiful method of applying coconut oil before wearing the personal protective equipment. Slowly, they developed into applying calamine lotion, and during COVID, when they were very thirsty or hungry, when they have to come out and drink water, they will have to remove the PPE, dispose it off, drink water, have their food, again wear a new PPE, and then again continue their work. So this was creating a very big problem to them. And many sweepers did not know the proper hand washing technique. They were just soaking their hands in water. So the proper 8-step hand washing technique was taught to them. And they were instructed to wash their hands before eating, drinking, and avoiding touching lips, nose, and eyes with contaminated hands. That was very difficult. No smoking, no drinking, no chewing gum or eating in the work areas. These activities should be permitted only in clean area like a canteen, and not storing hazardous material in the same refrigerator as food item. So these and all are some of the small steps that we need to take. Monitoring hazards is very, very important. Some monitoring tools include physical inspection,
Hello.
Hello, am I audible?
Yes, sir. Yes,
Okay.
sir.
Thank you. Thank you. Please keep responding. Otherwise, we will not know. So some of the monitoring tools, number one is physical inspection. So physically, we will have to inspect if all the equipments are working properly. Next is testing. Periodically, each and every equipment will have to be tested. Exposure assessment. In case if it is a radiological unit, so you will have to assess the exposure of the worker to the radiation. Constant observation. The workers will have to be observed constantly for their health condition. Injury and accident tracking. If in a particular place the accidents are frequent, we will have to probe and find out why the accidents are frequent in a particular place. Employee feedback and input. Occupational health assessment. Periodic health checkup. So these and all are the monitoring tools that we will have to use in engineering hazard. So we will have a recap. When you review a hazardous situation, you do it by asking certain questions. Question number one, have the present initiative solved the problem? In the morning, the number of patients in the registration counter is more. Too many patients crowding in a registration counter in a government hospital. The patients are standing in a queue and they are tightly packed. So there are chances that the infection may easily spread from one patient to another. So maintaining physical distance in a registration counter in a hospital, especially in the morning time, is very, very important. So to overcome that, in one hospital in Pondicherry, in the registration counter, they have created metal rails. These rails are in such a way that by instruction, the patient are made to stand at an arm's distance from one another in the queue. So this has brought down the contamination, cross-contamination, cross-infection, and on proper training to the patients, outpatients. Everybody later appreciated this move and the initial problem of overcrowding was solved. The second important question that we have to ask in engineering hazard is, are any new hazards being expected? So we call it as engineering hazard audit. So experts will have to check all the electrical connections, all the gas connections, ventilation, air conditions. So these have to be frequently checked. And in case if during the checking process, if they feel that any new hazard is expected, adequate steps will have to be taken to prevent that hazard. We should constantly ensure that the monitoring process is adequate. We should have workers adequately informed about the safety conditions. So every May, June, a number of new workers join. Some of the old workers get retired. So the new workers will have to undergo a orientation come induction program where they will be trained in all these safety parameters. And in case if there is a new instrument, or in case there is a new person to handle an old instrument, so we will have to ensure whether the person who is going to handle the new instrument is properly trained, and the training given has to be evaluated. What measures require for further improvement? Always better will have to become best, and best will have to become better. So the measures that are required for improvement will have to be taken care of. Has the effectiveness of hazard control been accepted by workers and followed? A very important is documentation. We will have to ensure that all the hazards and accidents are documented. So this review is very important, and in this review we should ensure that the questions that have been raised are answered, and by this way the engineering hazards can be prevented, can be managed, and the safety of the patient and all the stakeholders of the hospital can be ensured. So with this, we complete engineering hazard. So if you go through the keywords, number one, you will have to define what is hazard. Number two, you will have to classify hazards into physical, chemical, biological, electrical, and ergonomic hazards. Number three, you will have to find out the cause of hazards. And number four is hazard management. In hazard management, there are 5 steps. Step number 1 is assessing risk. Step number 2 is minimizing hazard. Step number 3 is controlling hazard. Step number 4 is preventing hazard. Step number 5 is monitoring and reviewing hazard. So all these steps are very, very important. And then we have the engineering controls. There are 3 engineering controls. One is called as isolation. The next one is called as process. And third one is called as ventilation. So these 3 engineering controls are very, very important. The next keyword is work practices. Everywhere, in every system, there must be a standard operating procedure. And the man who is handling that equipment has to be trained in following that standard operating procedure. So this ergonomics is very, very important. Continuing education and continuing training is very, very important to prevent hazards. Good housekeeping is the fundamental and basis in any hospital to prevent hazard. Personal care is the fundamental and basis in any hospital to prevent nosocomial infection. Nosocomial infection is hospital acquired infection. And lastly, monitoring is very, very important. So physical inspection, testing, constant observation, tracking of injury and accidents, employee feedback, occupational health assessment, and periodic health checkup. They and all play a major role in monitoring engineering hazards. And last is you will have to review the situation again and again. So with this, we complete engineering hazards. If you have any doubts, you may ask me now, or you may write to me. You can send me message or email. I will be happy to clarify your doubts. Participants, if you have any doubts, you can ask me. Participants, please help the resource person to know if the class is audible, if the slides are visible, if the slides are changed.
Hello, sir.
Thank you very much.
Hello,
Oh.
sir.
Yes, madam, please.
Sir, I have one doubt.
Yes, madam, please.
Sir, sometimes we get staff who are not actually holding the appropriate degree for a job. I'm
Very good,
talking about
correct.
hospital setup. So then
Yeah,
we
yeah.
bear the burden of training them from the start.
Yes, from the scratch, right.
And eventually they get transferred to some other department.
True,
So what is practically how to approach like this, sir? This being frequently happening.
Yeah, yeah.
How to practically approach them, approach a situation like this, sir?
Very good, very good. Excellent. Thank you very much for your involvement. I'm very happy that you have asked this question. I appreciate you on behalf of the Directorate of Distance Education for your involvement. Thank you. See, usually in a hospital, employee retention is very, very important. So if the employee retention is not there, this problem will crop up. You will have a new employee, you will train him, and after he is properly trained, he will jump to a nearby hospital using the trained skills that you have given. So the HR policy here, human resource policy here, has to be changed. So why does the employee constantly keep shifting themselves? It could be usually a problem with the salary. The salary and incentives, they must match with the responsibility and with the job, and it should be at par with that in the market. So this HR initiative will have to be taken. Number two, in many hospitals of late, they're entering into a bond where 3 months notice is required, or they fix up a period. You can shift only in the months of May and June. So this bond is on both sides. So by implementing this bond, especially in the health sector, so this problem can be mitigated. But again, there are a lot of legal concerns. So the law department will have to be totally consulted while entering into a mutual agreement or bond with the employee and the employer. The third one is involvement of the employee. The employee, the person who has joined newly, he should feel that he is part of a system. So that feeling can be given to him only by continuing education process. He should be constantly trained, and he should be exposed to the latest updates in the field. And this exposure and this inspiration that he is a part of a very big system, a responsible system, he is part for the system that is responsible for the health of the patient. This goes a long way in keeping him responsible. And small appreciations for the good deeds that he has done. So these type of steps will improve employee retention, and employee retention is an asset. So if too many employees are moving away from a hospital, that itself is an hazard, and that human resource hazard will have to be addressed in the similar manner as of this engineering hazard. So thank you very much for this beautiful question. This is a practical difficulty that is faced of late almost in all hospitals, but now in corporate hospitals, with the help of their HR policy, they are overcoming this hazard. Thank you very much.
Thank you, sir.
Thank
you. Sir, if time permits, just one more doubt, sir.
Yes, madam, please.
Yes, sir. Actually, I'm talking about the government sector. The recruitment rules with which they take technical staff, because I am towards blood banking side, so I'm talking my difficulty, sir. So the technical staffs whom they are recruiting is based on the, I think, old recruitment rules.
Yeah.
I'm not much familiar with that, sir, but you will be very familiar with those rules. So what practically we are people who do not hold a degree in lab technical MLT, or they are not getting recruited, sir. Because they say the recruitment rules whatever permits, they have taken people with +2 pass, and these staffs are coming as lab technicians. So, I know it's not immediately, we cannot change anything in the government, but how do we report this, sir? Like whether they will review the recruitment rules so that in future, at least a basic of BC MLT or a DMLT candidates can come in who are actually worthy for the job.
Yeah, it's a very good question. Thank you very much for
Thank you,
asking this
sir.
question. I'm very happy that you have asked this question. This question in government setup is now being addressed by the starting of a paramedical council. So in the center, there is the formation of a paramedical council, and similar paramedical councils are being formed at state levels. So this paramedical council will take care of medical lab technician, physiotherapy, occupational therapist, phlebo technicians, and all. And the recruitment rules will be updated by this council. Once it is updated by this council, it will be intimated to all the state governments for immediate implementation. So it will be first implemented by the central government, and then it will be implemented by the state government, though health is a state subject. So here, the uniformity of the recruitment rules will be ensured if this paramedical council takes its full form. So this is a welcome move by the government of India. So already the central council is in place. As council in Pondicherry is on the creation, so it will be created soon. So one such monitoring body, apex body, is there. So this problem of updating the recruitment rules will be done regularly, periodically, and it will be uniform. It will be at par with central government. And in future, this problem that you have just now raised will be solved, and we hope and pray for it.
Thank you, sir.
Thank you very much. Thank you, participants. Thank you. I think the next session will be by Dr. Duraivel, and I thank you very much for your involvement, commitment. Thank you. Have a great day. Bye.
So very good morning. So
Good morning,
today, good morning, sir. Good morning, sir. So today we are going to have a topic on telehealth and telemedicine. So past 3 days we are discussing about hospital information system and EHR and EMR. So today it's totally on taking up on Internet of Things. Well, so the objective of this topic is telemedicine definition, history of the telemedicine, how it has been developed, and different types of the telehealth and telemedicine. The specialties using the telemedicine in medical services, what are the different benefits, then how the consultation has been done in telemedicine, and purposes, any consultation organization, all these things we discussed today. So, what is telemedicine? So, it is a term given to remote healthcare delivery to consultation given to patient at a distance. So, as per the World Health Organization, it's healthcare as the delivery of healthcare service where practice and the providers are separated by distance. Tele means it, you know, that it's like an conveying through some kind of media. It's not telephone, telegram. All these things are all to connect the people from different distance who are not close together. So that way, the health services also provided through the telecommunication. So that is telehealth or telemedicine. So we have to thank this high-speed internet. So otherwise, it is not possible to provide all these things. Now the internet occupied the world, so everyone have got their the mobile phone. So it is like sometimes no, when we are not having our phone, we feel like handicapped. So that much dependent on this. Not the what are the services or the medias which we are using. More than that, we are dependent on this Internet of Things. So that way, it has occupied large all over. So now we are making use these kind of these facilities in that advancements, the technology to use in the health services. Uh, so we have to. I mean, now even the 5G has come, more speed. So health professionals can perform remote diagnostics and provide virtual healthcare services to patients who cannot travel to the nearest hospital location. Actually, it has been launched as an initiative to serve the elderly. The telemedicine or telehealth was earlier proposed for elderly people and vulnerable groups, and patient living in remote locations. For those, it has been like implemented these services. Then later on, it comes to an mainstream 2020 after that corona outbreak. So before the pandemic, one quarter of patients were not interested in trying telemedicine. However, many were prompted to use remote healthcare services during the outbreak. Then they realized that such a virtual appointments do not differ much from in-person visits. Uh, like the telehealth now further translates to higher adoption levels after pandemic results. 83% still we see themselves using telehealth services for patients. Well, even no, not only in healthcare, this and telecommunication. Even the legislators also they are using it in their profession. has been occupied in wherever it has been need. Like already we can see that this online shopping. So nowadays nobody is going for personally to shop. They are making it online shopping and food delivery. So everything has come out online, and there is like a platform where you can get everything by sitting at home. The same way, the healthcare services also provided to the needy people, or where it has been developed because of this advancement. The health care is provided to patients without they need not go to hospital. They can sit at home and get this. So this telemedicine allows healthcare professionals to evaluate, diagnose, and treat patients at a distance using telecommunication technology. Then what is the difference? Whether this telehealth and telemedicine or both or same, or there is a difference? Actually, the telemedicine is another term used frequently along or instead of telehealth. However, there is an important difference between two of them. Uh, So, according to the American Association Foundations, they are making is telemedicine is a medical practice of using telecom infrastructure to deliver a remote care to a patient. So that is based on that American Association Foundation. The telehealth, no, on the other hand, refers to the underlying technology as healthcare that is required to provide care and medical services remotely. So it may include software, telecom, and connectivity infrastructures. So many things included in this telehealth. Contrary to telemedicine, no, telehealth encompasses a wider range of services than telemedicine. Like telemedicine, no, it refers to clinical remote services, while telehealth refers to non-clinical remote services. So it includes additionally, apart from the telemedicine, it includes additionally so many other activities. So in a broader sense, it has got broader scope for telehealth. We can, for understanding more precisely, we can say that in the telemedicine, it is the clinical aspect. So purely clinical aspect. But in the case of telehealth, no, it comprises of many things, including the diagnostics, the consultancy, and supporting system and monitoring system. So many things are added to telehealth. So in that way, both are interrelated, but there are difference in the telehealth and telemedicine. Well, we'll see the history of development or revolution of this telemedicine. It's not a new practice. From 19th century, we have been using in a different aspect this how these remote located patients have been treated by the different way of see those days. No, there are the mobile hospitals or mobile clinics where every infrastructure or every need, every system will be set up in the mobile vans. That will be like how with the ambulance is there, no, like that it will be there. So they'll go to the rural places where they treat the patients. Now, then later on, once the advancement in technology, in the telecommunication technology, even the people have made it in a better way rather than taking the mobile clinical system. So, date back the 1876. So, Alexander Graham Bell, he patented the telephone and launches the beginning of our telecommunication field. Then 1924, Hugo gets back. So he envisions the teledactyl, a tool with robotic fingers. tactile means fingers. In 1950s, the medical personnel start doing experiments with closed circuit television, CCTV. So with that, like in 1960s, NASA takes on telemedicine, which is researched ways to provide health to astronauts and improve telecommunication as a technology. See, once the astronauts know that they left Earth, they may not have any connections, so they'll be connected through only the communications, the telecommunications. So that way they have been treated if at any cost. In 1970s, the late 70s brought a golden age of telemedicine research and expansion. Federal government funded a range of telemedicine programs to improve healthcare access in the rural areas. In 1989 and 1999, the first time a patient was successfully treated through telephone, and ATA is created as a non-profit organization. But these are all from the US, not in our country. The status in our country will discuss later or in some other class. And then in the 20th century, video chat programs and apps like Skype taken place. So that has been utilized. So nowadays, the video calling is very simple. One is talking through video call. So whoever the near ones and relatives staying abroad or other states. So we are talking instead of oral, just we are making the video call. So that way, that the video call apps, so many video call apps have been come. Not only that, it's only for communication. It has been for learning process. So for that during the pandemic, a lot of online classes and webinars have been conducted. These and all utilize the platform like WebEx, Google Meet. Now also we are making its online classes. So this is and all the communication development, how it makes utilized the same way the healthcare also utilized these apps. Today, the telemedicine is most people have access basic telemedicine devices like mobile phones and computers. It improves accessibility. Uh, in 20th century, William Einthoven, the inventor of the electrocardiogram, was among the first scientists to propose the concept of remote service delivery. In 1906, he published a paper detailing how telecardiogram might work. In 1925, the medical community speculated how telemedicine companies of the future might look like. So they made different aspects like agenda, and by mid-century, telehealth started getting closer to the earlier envisaged reality of 1948. Doctors sent radiological images via the telephone for the first time. And in 1960, Nebraska Psychiatry Institute started using the CCTV, performing remote psychiatry consultancies. Then in years now, in 1993, they found an association, American Telehealth Association. They are many of today's telehealth are the practice where they made the standards of this American Telehealth Association. Of course, the boom of telehealth happens in the 21st century. The internet connectivity has become ubiquitous and low latency, allowing to transmit large volume of data in near real time. So the doctors can exchange more advanced imagery and high definition video to perform diagnosis. So nowadays the fiber optics have come. So broadband services are there. because no, it has to be continuous when any video conferencing made for this telehealth. There should not be any break, the voice break or picture break. So it has to be very clear. The advancement of this 5G, fiber optics, and the broadband that has been helped for development of telehealth in these centuries. Then what are the telehealth services available to patients today? One is a patient portal. So we can keep individual patient have their own portal. Like they can have, they'll interactively make it. This portal has got all the informations about the patients and their medical history. Then online doctor consultations. So this is what happening nowadays. So many places it is going on. After this corona outbreak, many people are continually using this online consultancies. So here you can telephone, through phone you can consult a doctor, or you can do a video conferencing, or you can send any of your the medical data through many apps are there, through apps, so that will be reached the doctors. They'll check it, reply those an outcome through the same app. So so many other way it is the doing the telemedicine or telehealth. Then remote virtual monitoring. Like there are so many equipments, so that has got connectivity with this telecommunication. So, for example, what we can say means like the um, pacemaker. Pacemaker is like it is initiating, triggering the heartbeats. So that may be connected with through this internet that has been monitored by doctor at the remote place. The patient may be in any village or rural place, or any even the city also in some distant place. So is pacemaker can be connected to the app, through the app and in the internet, that can be monitored by the doctor from other or distant place, some other place. So that way it can be the remote with vital monitoring. Then EMR EHR system, that is what we have seen yesterday class, electronic medical record and electronic health records. Then medical wearables. Nowadays, these are all very familiar. So everyone is wearing these smartwatches and health watches. So that will count your steps, count your heartbeat and heart rate and oxygen level. So many advancement in these wearables. So it monitors one's health conditions regular throughout. If at all they are connected with that wearables, then throughout even 24 hours it is monitoring it. So these are all different components that are available with telehealth. Then what are the benefits of telehealth? Or just we'll see the telemedicine types first. So one is live video conferencing. It is two-way audio visual, like a link between the patient and healthcare provider. So this is to this video conferencing is used to treat common illness. Uh, like it is like exactly one to one how the patient is meeting doctor personally the same way, but it is in a conference, video conferencing. Instead of physical presence, they will meet in a video conferencing. So the common illness can be treated in this way. Then store and forward surpasses the need for the medical practitioners to meet in person with the patient. And like here, no, everything is gets stored. Like maybe it's recorded one. And like data such as medical images or biosignals can be sent to the specialist, as needed when it has been occurred from the patients. So everything is stored like earlier or recorded thing that can be passed or forwarded. So this may be like an agents. They'll collect the recorded aspects of patients or their details that can be forwarded to the physician. So here there is no need of medical practitioners to meet the patient without meeting them. We have seen, the live video conferencing. There, the patient is meeting the physician in video conference. Here, there is no need of meeting the medical practitioner. Everything is forwarded to the medical practitioner. So that way they'll go through the details and then they'll revert back. Remote monitoring. So the use of connected electronic tools to record personal health and medical data in one location for review by provider in another location, usually at the different time. So this is what I said, like the pacemaker. So that can be monitored by physician in some other place remotely, and sometimes sometimes it can be even controlled remotely. So I said only one example, the face maker. Not only that there are so many apps out there. So even your heart rate and blood pressure, then diabetic informations. So all also been monitored remotely from remotely, provided the patient have to use the equipments that is having the internet connection and connectivity or app connectivity. So then this remote monitoring is very simple. Then it is be easily done. Then real-time interactive services can provide immediate advice to patients who require medical attention. So this is like no always the people are be ready for your question. So if you want immediate connectivity. So earlier, no, the things in the video conferencing, you have to take an appointment to the patient, because the telemedicine telehealth means there is a time limits, no, like they have to give appointment in particular time they can meet this patient, like that. So here in these real-time interactive services, you do not have don't need you don't need to have such a kind of appointments, prior appointments. So it is ready once you start and typing in chat box also is there. Once you want to ask anything related, then you can chat with the people, or you can call the person and talk to them. So this is real-time interactive services. So these are all different type of telemedicine. Then what kind of medical specialties can be used in telemedicine? Radiology. Radiology is like X-ray. Uh, so this specialty is in using medical imaging techniques to both diagnose and treat diseases. Uh, Radiologically, like no another thing that not only for the bones and joints, even even for other any accumulations in the body, uh, or any swelling inside the whole body cavity or organs, that can also be seen in the radiology. The X-rays, something like that. That depends upon the person, the experts, how they can interpret. So that is one specialty in telemedicine. So another one is mental health. So it is the most popular specialties for telemedicine. Mental health practices can increase revenue, streamline patient flow, and provide counseling session from anywhere. So this is very, lucrative. Uh, it is not like you can think that it is only the psychiatry level. Even there are people in a depressed condition, stress condition, their mental health is affected in so many ways. We need not restrict this telehealth or telemedicine only for the psychotic problem. It is also extended to the depression, anxiety, or this stress management. So their mental health will be that the psychiatrist, psychologist can counsel the patient through telehealth system. Then pediatrics. Now the problem is we have to bring the children to the pediatrics means children care to the hospital. So we have to once again here also we have to take the child to the hospital or the clinics. So through these telemedicine, this can be minimized the time travel to the clinics or hospital, and making the child is not afraid of the crowd or going out. So they feel like at home. The child feel like at home. They'll play. But through this telemedicine or telehealth, we can make to treat the children by keeping them at home. So it is more advanced. Advantages are there by this the treatment through telemedicine in the pediatrics. Dermatology. This is regarding the skin problem. So through telemedicine, a patient can connect with their dermatologist using a smartphone, tablet, or computer. See, since it is a skin problem, they can take a picture or they can show the picture of the skin problem to the dermatologist. So by seeing that, they can suggest what kind of treatment they can go for. Now we'll see the benefits of telemedicine. So there are so many benefits. Access to specialized healthcare services under served rural, semi-urban, and remote areas. When done online, no, the regular checkups help both the doctors and the patients save time. So it is continuing, not only just for the beginning. So once they have made any telehealth, patient meet the doctor, or by video conferencing, or like forwarding the information through EHR or EMR. So the follow up also is there. After that, they'll monitor the doctors or nursing assistants and nurses. They'll also monitor throughout the course of this treatment. Uh, so that is the regular checkup. That is what we called. So usually, when we are making in this the pregnant women, so they'll go for a regular checkup to the hospitals. So those things can be done on in the regular checkup. And in some cases, no, like they have to travel. That is what I said. No, like we have to travel for hospital and we have to take a leave. So these can be minimized. These can be removed while these telehealth and telemedicine are used. This is one of the best benefit for the patient. And they can access expertise of medical specialties to larger population without physical referral. Like for example, no, there are experts, the specialties. Like for cardiology, there may be a few of the physician or famous. So through this telemedicine, telehealth, no, it is easy for the patients to meet those experts. Otherwise, if at all the physical, physically to meet, the getting appointment is very difficult. They might have got a lot of pre-booked appointments, so the patient may cannot take the appointment of such experts. So that can be made through telemedicine. So that access to expertise medical specialties, and reduce the visit to specialty hospitals for long-term follow-up care for the aged and terminally ill patients. So this is what we have I mean, in the beginning we have seen the telemedicine and telehealth started the earlier year. I mean, the beginning of this telemedicine advancement is for aged people. So they need not go for a long distance, or they need not wait in the queue to meet a doctor. So the all follow up can be done through telemedicine. Then lower service cost. Telemedicine reduces the overheads. Uh, of providing care. Once again, the net cost savings for telemedicine, they may women like in America they have calculated. So it is 19 to 121 billion, depending on the visit type. So they have made the statistical data how much have been reduced because of like through this telemedicine. When we are using the telemedicine, the cost reduced. So this is one way reduce the burdens to the patients who can utilizing the telehealth or telemedicine. Then innovative care, the Internet of Things, sensors, and the remote healthcare applications can be used. That is the new era of healthcare. Nowadays, the patients can receive timely medicine administration at home via medical gadgets that can automatically disperse injectables, drugs, and send vitals to the healthcare providers. And Zoom, no, that is one of the platform that can be utilized for telehealth service. It's very popular one. Then the patient can easily schedule visits with the specialties whom they want to meet. In that way, it is whether the dermatologist or gynecologist or the pediatrics. So that leaves the patients access to the uh, broad range of expertise. Then teleradiology was among the first telemedicine services we have seen in the history of telemedicine. Then the film used to be scanned through a digitalized app. Nowadays, there are images that read directly on a computer, allowing images to be viewed anywhere in the world. Throughout. So there may be the app, even the scanners are there, no? Like how we are making the QR code scanner, so it can scan the images and transport, or it may convert it to digitalized manner. Then by scanning that we can get retrieve all the data. So the teleradiology is one of the telemedicine. Then telepharmacy, doctors can now enter electronic orders for drugs, review them remotely, and even dispense medicine remotely with the help of video conferencing. The entire pharmacy experience can be done remotely. So that leads to some solid benefits for the patients and healthcare providers. Then online therapy. The telehealth counseling services have gained a surge in popularity during the pandemic. Because those times nobody can come out or they cannot socialize. Then the mentally taxing times that made a lot of sick, like what to say. That is what the main thing we are to meet to consult a doctor for 15 minutes or half an hour. We have to use we have to be there at half an hour before the traveling time, and so all these things has been cut down due to this online therapy. Then telehealth, the physical therapy, Physical therapy, we can say that physiotherapy, that is physical therapy. Some of the they used to visit the home for giving the training to the patients, how they have to move their limbs and in the which extent they have to move, what kind of exercise they have to do. All these things they have done earlier. That can be done this telehealth, the virtual mode in a better way. So even after any surgical procedures of bone and joints, this physical therapy is the follow-up that can be done through virtual mode. Then continuous education and training through video conferencing. That is another benefit of. It is a benefit to physician. So one way the benefits through to the patients, another way it is more benefit to the physician. So they can also more time when it is virtual mode than the physical mode. So that way the physician also get benefited. And then how the hospitals and the insurance companies are get benefited. So there is a significant reduction in unnecessary visit, hospitalization for specialized care at territory hospitals. See, the hospitals, even if they are having minimum space, they are having the multi-specialty branches, but the bed size is minimum or less. Then they need more of outpatients, or before they get admitted they want the consultancy type of things. So all these things can be improved, or more kind of patients, more number of patients can be treated through this virtual mode. Then later on they can be suggested, they can be referred for admission to the hospitals. So based on the availability of the bed, they can say that they can make the priority to the patient, different patients who are already in the consultation. So they can give the importance and the priority, and that way they can manage the availability as well as the demand of the services. So that way the hospitals, they are benefited. And earlier discharge of patients leading to shorter length of stay in hospitals. So this is the patients can stay in the hospital for a shorter period. Uh, that may improve the more number of patients can be treated based on their needs. And insurance, they want they also been connected with this telemedicine or telehealth. The standards are there. Those standards are to be complied. So the insurance benefits also been utilized by the patients through this telemedicine and the telehealth. And what is teleconsultation? Teleconsultation, sometimes referred to as remote consultation or telehealth, refers to interactions that happen between a clinician and the patient for the purpose of providing diagnostic or therapeutic advice through electronic means. See, consultations, it is before starting any treatment, the patient can meet the physician too for the consultation. Uh, for example, there are so many kind of ailments uh, that needs consultancy or consultation with the doctors before getting a choice of the treatment, what kind of the treatment they can go for. So for example, diabetics is there, that can be treated in many ways. So that can be consulted with doctors, diabetic doctors. So like that, before any surgical procedures, so they can consult the doctor whether they need a surgery or they can go without surgery. or any other alternatives are instead of surgery. All these things can be done in the consultation. So the consultation is one of the thing, and by the way of consultancy or consultation, the doctors can refer the patient, like whether you have to go for a surgery, or whether you have to be get admitted, or whether you need some more diagnostic procedures. So all these things can be done in the consultations. The purpose of teleconsultation, the goal of teleconsultation is to omit a geographical and functional distance between two or more geographically separated healthcare providers. This is one kind of wonderful thing. Like I would like to take the consultation of a doctor who is residing in US, or who is residing in UK, or who is residing in Australia, Canada. So there is no geographical restriction. So let the physician or expert stay wherever. So we can take the consultation through this telemedicine. So this distance is not a matter at all for the consultation. That too, we can make the consultation for from any other country, where the physician or medical practitioner is residing or practicing. So this is a kind of advanced way how we can make use of the telemedicine for consultation. There is no transportation, time can be reduced, cost can be reduced. So this is an advantage, and no need to take time off or work. So for in this case, no, like we have taken appointment for 1 hour or half an hour. So that half an hour, if at all you want to meet a physician, you have to take a leave. If at all you want to meet a patient personally, to go to hospital or to go to clinic, so you have to make a leave from the workplace. But in this case, no, you can need not take the time is less, no, to meet a physician virtually. So you need not take any leave or work off. That particular time also, time alone, you can take the permission. Then you can complete the procedure. Then eliminate child or elder care issues. Uh, so elders, the transportation of elderly people is very difficult. The moment, so they are getting, into the bus or the own vehicle, or even whatever the vehicle, because of their age, the traveling to the distance, that is all very difficult for the elders. The same with children also, managing them to transport them from home to clinics or hospital. So these things can be eliminated by this telemedicine. Then on-demand options, on the necessity or need, we can go for wherever the facilities or services are available. So that way the options are more. The access to specialists, so experts can be easily accessed. More than one experts we can cross-examine. Like for example, once we meet one specialist or a doctor, so he is suggesting some kind of procedure. So we can cross-reference. We can go for the another experts for secondary opinion. So he is also saying the same way, same thing. Then we can decide. Otherwise, no, the second opinion in this other doctor may give option. So that way we can access the specialist in telemedicine. That is very easy to through telemedicine or telehealth, unlike in, personally meeting the doctors. Once we meet doctors in hospitals or clinic, so the timing which we have spent is more. So that time consumption is reduced. Also, we can access the specialist easily. Less chance of catching a new illness. This is very, very important. So when we are entering to the hospital, many kind of patients are there with a different kind of illness. There is a possibility of crossover. We can get easily affected or infected or communicated by diseases which the other patients are having. So since we are not exposed to such a things, this telemedicine and telehealth is safe. Then less time in the waiting room. So we need not wait for more time. Though you have got appointment, you have to wait for meeting the doctor. So then you may get an appointment of 10 o'clock. So you may have to be there half an hour or 15 minutes before that time. Even after 10 o'clock, the previous patients may take some more time. So the 5 or 10 minutes is extended. So that way, they may not give exact time sometimes. They may give the appointment or 10 to 11 or 11 to 12. It is a range. So with that period, you have to be there. So that kind of waiting time can be reduced. Then better health. Definitely we'll have, whether it is telemedicine or telehealth or physically we are meeting. See, there is no much difference between the physical visit and telehealth or telemedicine. Only thing, no, the psychologically we may feel like we are not physically meeting the doctors, or there is no physical touch by the physician. So they are not touching us to take the pulse rate or heartbeat through a stethoscope, something that, or examining through hands, something like that. It is not. It is absent. But still, there is a possibility of diagnosing the patients through virtual mode. Only the psychology affects. Psychologically, we feel like we are not meeting the doctors personally. Otherwise, both the way we can treat any kind of diseases. Teleconsultation organization. There are so many organizations. They are making this option very simple. What are the different steps? So in this organization, you have to in the OPD, you have to enter with a local doctor checkup. Then they'll treat. If they are not referring you as a telemedicine system, then you can, with the treatment, you can go. Otherwise, the patient can be referred for telemedicine system. Where these kind of options comes means when the patient needs expertise specialist for the treatment. Otherwise, the local doctor themselves make the treatment. Then the outpatients department itself, the patients can move out. So when the patients are need more more kind of focused kind of treatment, or more expert needs his own opinion to treat the patients, a specialist to take the decision to treat the patient, then in that is the case, they'll refer to the telemedicine. Then patient visit telemedicine data entry console. So operator enters patient record, data and images of test results. Then they'll take the appointment. Then they'll meet online session of telemedicine. Step 2 is appointments are there, patient 1, 2, 3, 4. So they'll meet through online video conferencing or under teleconsultation for patients between local doctors at the nodal hospital and the specialist doctors at the referral hospitals. So they'll meet the patients in through teleconference, whether they may be the referral hospital or specialist hospitals, nodal hospitals. So this is one society, International Society for Telemedicine and E-Health. This organization determines to facilitate the international dissemination of knowledge and experience in telemedicine and e-health and providing access to recognized experts in the field worldwide. So as I said, no, you can meet the expertise in the consultation for geographically, like anywhere that experts may be, you can meet. So these organization making it very an easy way. So this is a nurses telenursing network. So they are going strive to educate, support, and collaborate with nurses and nurse supporters from across the globe who have an interest in telenursing, with the goal of improving the timeliness, quality, and access of broad range of healthcare services. See, this telemedicine and telehealth, no, not only with the physician, so that follow up and monitoring and nursing assistance that can also be provided. That is called telenursing. So they are providing this kind of services also. Uh, so this is all in the US. So just for an information, you can take it up. So OIT rural health policy promotes the use of telehealth technologies for healthcare delivery, education, and health information services to promote and improve telehealth services in rural areas. So they made the US, the federal office, no, they make it the standards, and there are some organizations, they are making use of this telehealth to provide services, health services to the rural people. So ultimately, it's a platform for health practitioners aimed to provide channels of communication between health practitioners of various specialties and provide services that facilitate their work and raise the level of service provided to patients. So these are all the references from which I got all these informations. Thank you. We'll meet next class tomorrow. Thank you very much.
Thank you, sir.
Sir, uh, sir, is it audible?
Yes, sir.
Shall I present? Okay. Share. Sir, is it able to see the slide, sir?
Yes, sir.
Okay. It's changing now, sir?
Yes, sir.
Okay, thank you. So, very good afternoon. We'll continue the quality aspects. So, we saw up to what is meant by quality, then why the total quality is required, what are the benefits of total quality. So, why need, how to can be that total quality can be determined and measured, then rectified by using of quality tools also we saw. Then what is the time scale of quality design approach, when what are the approaches in the year-wise establishment we saw in the last class. Again, I'll start with that and I'll proceed go for that. Actually, the time consuming time taken for this is around almost 100 years. If you start from the quality perspective, it's 1922 2020, it 100 years. The various technology change over time to time. First, the earlier stages of this, they will inspect in the product, they will go for find out the quality aspects and try to correct it. That is in the finished products. When in the 1940 and 50, the introduction of statistical tools like all design of experiments or any type of statistical tools incorporated into follow the quality by design approach. That is what it means by that. So statistically, they wanted to correct it. If I am giving what will be a output, it will come. That is the statistical significance they wanted to establish. In this year only, the quality concern start by Juran in 1950s. Many things we discussed with history of quality. That is the period we started the quality initiative by the Juran. So then followed by that three Americans went to Japan to introduce quality aspects. In response, that three Japanese for involved in this to continue the quality aspects. That happened in this 1940 to 1980. Then improved design. How to improve the designs in the later stages of 90s it came. Then quality through design approach by the FDA. It started in the year 90 to 2000. Now we are in the process of TQM. This all we saw that in the timeline of the development in the quality aspects to satisfy the consumers. Whoever may be a consumer, their satisfaction we need to fulfill with safety and efficacy. Since why I am telling safety and efficacy, since we are in the pharma sectors, healthcare professional, if our products are anything impurity or not up to the mark, it may not be not only a financial loss, it may cause harm to the human beings. So the patient oriented things are very, very essential. That is the reason our product in the sense pharmaceuticals or healthcare sector, healthcare systems may produce a vital role in the satisfying the customer without compromising the safety and the efficacy of the patient. That is what I wanted to continue with this. Then we saw that what are the gurus are available. Then these gurus introduced, these are the gurus. Our last class also I showed Joseph Juran. We are even though Fagenman Bagam also involved, but major we are following Joseph Juran only. So today also we are going to discuss about Joseph Juran terminology only. Joseph Juran, three important point he said, that is called as Joseph Juran trilogy. So these three people went to Japan to introduce the quality. Then another three people came to the picture, that is from Japan. Then Ishikawa. That is why we are following that all QC tools majorly influenced by Ishikawa. They have introduced 7 tools. What are the tools also? Already we saw this. Based on the tools only, these are the 7 tools. In the last class I checked, informed one by one what is meant by check chart, histograms, starter diagrams, control chart, run charts, Ishikawa diagram, and Pareto diagram. So this all will be incorporated into a quality control team to produce a quality product. So how I can check the quality product or not? By using these tools. 7 tools we are going to see. This all already I explained in the last class. Now who are the quality gurus also are involved in the last class? The Crosby, Deming, and Juran. These 3 people are major role playing in that. Again I said, now we are in the process of following Juran's concept only. Juran given 3 trilogy, that I'll go, it's all discussed one, but now this is the thing. Quality planning and quality improvement and quality control. These 3 points are very essential according to Juran. Juran given this they may call it as trilogy. They may ask you to write and in detail or discuss about Juran trilogy. Then you have to write planning, quality improvement, and quality control. These 3 steps involved in this. Based on that only, the cost also involves. That we are going to discuss today class. This is the first chapter, last portion. Then what is meant by cost of quality? So we have to consider as a 2 part in here, the types of quality. Here first one is cost of good quality, COGQ. Normally COQ only they may call. Some people may terminology use COGQ or anything you can follow. COGQ means good quality, the cost of good quality. Then same thing COPQ means cost of poor quality. These two things involved in this two type of things are available. Cost of good quality, another one is cost of poor quality, COGQ or COQ. Then other thing is called as COPQ. So now we'll see what is meant by cost of quality. The cost of good quality is defined as the cost associated with providing good quality products or services. So this contains two part. Two categorically we can divide this good quality cost. That is, one is for preventing cost, then another one is appraisal cost. These two are the things are very essential. That means cost related to produce a quality product to prevent the errors or mistakes or whatever the problems, issues happen, that we are going to prevent. That is called as first point. That is cost related to prevention. Then second point is inspection, appraisal. That is inspection, testing, audit, quality control department or quality assurance, periodic checking, periodic random wise checking. Then who are people to identify a quality person to check and audit and the generating of report related to that, whatever expenditure happening is called as that appraisal cost. So now normally these two costs put together will produce a quality product. That is why the quality product is able to produce whatever the spending I am for towards enhance the quality product, that is called as good quality, cost of good quality, COGQ they may call us. That is consist of two things, prevention and appraisal. Then second, so history of cost of quality, that is what is the how the quality history starts, the cost of quality. So the first, as I said, Joseph Juran was the first discussed about the cost of quality in 1951. That is a year I already said that. Anyway, once again I'm telling, in the first edition of quality control handbook, he only released the first book related to quality control. That book he discussed about the cost of quality. The followed by Fehrenbaum, who developed a cost of quality concept in total quality control around in the year 1956. That means 51 the first cost of quality come to the picture. Then followed in the year after 5 years, 56 it started and developed further. In the year 1980s, got popularized COQ. COQ in the cost of quality is popularized. In 1990s, COQ included in Six Sigma. Then in future, we are going to study what is meant by Six Sigma concept. That concept came with the quality ensuring terminology. That is, then 1998, COQ included in QS 9000. The QS 9000 only in future, it is developed as a ISO and TS that comes in the year 2002. That they may called us in the year volume of 16949. So that the poor quality also included in that year, the same another 4 years back, that is 2060 onwards, the IATF 16949 class 9.3.2.1a given for the poor quality. So now we need to understand what is meant by good quality. We are seeing what is meant by poor quality also we should understand. Okay, anyway, these are the histories from, so 70 years we are discussing approximately. I am telling 70 years the started of cost of quality into the pictures. Later was two people involved majorly. One is Juran, another one is Fehrenbaum. But even though Juran's ideology is the final, we are following now. Sir, slide changing now, sir.
Yes, sir.
Yeah, okay, thank you. So here you can see the difference between the Fehrenbaum ideology and Juran ideology. What are the costs involved in the any part of industry or whoever involved in this? Say approximately 5 to 10% for preventioning of cost. So the quality product I need to provide, what are the preventive steps I am taking care for that only 10% of cost. As per Fagenbagam, it is shows that only 10%, but Juran allows only 5%. Then detection and appraisal cost, that is all quality control test, including audits, all the formalities. 25% is given by the Fagenbagam, but Jurons is allows up to 50%, 10 to 50% he is allowing. Then failure cost is a poor quality. Failure cost around 65 to 70% occurs in the uh, poor quality aspects, that is failure cost. Then here Juran divided into a two category: failure cost, internal and external. In the coming slides we are going to discuss what is meant by internal and external. Is given 25 to 40% for internal errors, then 40 to 20 to 40% for external errors. So these are the way they are classified, that two gurus in this, Fagenbagam as well as Juran, classified the cost involved in this. So now, what is the types of cost included? So cost of quality included two category. One is cost of good quality, another one is cost of poor quality. As I said earlier, cost of good quality involves only the prevention cost and the appraisal cost. That further classified into prevention cost and appraisal. Appraisal in this, all the steps you are taking towards the check or identify detections or quality ensuring, everything will comes in the picture of appraisal cost. What is the step of prevention cost? Whatever you are giving to the preventing that errors or find outing that where the possibility to do the errors, that I am preventing, that is called as prevention cost. So this good quality classified into two things. One is prevention cost, now second one is appraisal cost. What will be coming? Prevention cost examples. The next slide will see appraisal cost also. Then another category, it comes to the poor quality. Anything is good, then poor also will be there. So poor quality. So poor quality further classified into two category. One is called as internal failure cost. Another one is external failure cost. That we'll discuss what are the things will comes in the thing. So normally the cost of quality classified into two category: cost of good quality and poor quality. Each one divided into two category. Good quality will be further classified into prevention cost and appraisal cost. Then cost of poor quality divided into two category: internal failure and external failure. Here you can see this. What is the prevention? What is the appraisal? What is the internal failure? What is the external failure? The internal failure and external failure terminology given by Juran, but failure, Fagenbagam says that only failure. But anyway, now we are, as I said, only Jurans we are following. Then see, prevention. What are the things are prevention? So preventing the errors or mistakes or whatever the drawbacks, we by giving training, yearly reviews, quality planning, tools, appropriate tools usage, process improvement initiatives. These all come to the picture for better to prevent the problems arises. See, for example, as everything is says that you need to give very important concern to the particularly the person who is going to be work in that place. You need to educate, you make them to understand each every steps of process. Then they may identify the where the critical parameters will come to the picture to avoid the mistakes happen here. Then anything, whatever the earlier product is available, what is the methodology incorporated, you need to take to the consider to review that. Then from the based on the output of review, you have to planning for your experiment. Then appropriate tools, when we are planning, sit together and brainstorming, you may find out the best tools or updated tools maybe produce quality perspective. So that all you need to take into consider. This is called as prevention. What are the expenditure related to this? Giving the training to the staff members, then reviewing that whatever the printouts, what are the booklets, what is the database you are generating, then planning and the experimentations. These all tools, what are the tools you are purchasing, this all they may call as prevention cost. Then second point, appraisal cost. Appraisal cost definition is cost associated with analyzing and testing the product to ensure it conforms the specifications. Here I already said that any industry have their own specifications that may called as, in that terminology name called as in-house standards. In-house standards. So that is some regulatory authorities standards also may available. So that and all you need to fulfill. So that is what are the costs you are spending towards to confirm the specifications, to satisfy the specifications. That is and analyzing, testing, determination. These all what are the steps you are performing to identify the deficiency or problems arises in the steps or process. This whenever the by continuous frequently testing, by auditings or random inspections or any type of quality control test, this all comes to the appraisal. That is here I think example we given, inspections, periodic inspection. Your own industry people inspect, or somebody will come from outside will inspect, or testing the quality of the product, audits, quality control test, everything you need to perform that. That will be very very essential to produce a quality product. So that what are the costs related to the testing, they are providing the information towards the quality assurance, what are the cost factor involved, that is called as appraisal cost. These two are called as good quality cost. That means cost of good quality. So that is COQ. They may call it as COQ. So that means, so these two are normally will help to inform the what is the quality product you are manufacturing. What that means. So these two are taking as per the gurus, that is Begum or Juron's maximum 20 to 30 percentage you will be spent to this cost. Then another one is then third one, internal failures and external failures. These are all called as poor quality cost. The cost involved of poor quality, that may called as COPQ. COPQ. Internal failure and external failure cost involved. That means that is poor quality cost. See, cost associated internal failure, cost associated with the fixing defects found prior to release. Here, then another one, the examples: repair, retesting, updating, documentation, reprocess. Everything happens here. So I wanted to tell you one example here. If I am manufacturing, you consider we are the manufacturers of Tums tablets. We manufacture a tablet, but the tablet not fulfilling the standard requirements. Then documentations all failures. Then what I have to do? Then I have to go for reprocess the tablets, because I made prepared in the tons. So what is the lot? So I cannot throw it off. Then I am, if possible, I have to make it that to how to correct it, reprocess. If you consider in the packaging error happen, you see the tablet packaging error happen, that can be repairable. So that removing the package and repack, that is somewhat okay, manageable. The cost involved in that, that is called as internal failures. So if the same thing, if I prepared a tablet, so then what I have to do? Then if that disintegration is fails, the tablet doesn't breaks or does not able to break the tablet, it not able to dissolve in the stomach, then it will not give the pharmacological activity. Then is it not possible to reprocess? No, that is not waste. They will come to the picture called as waste. That is, this is called as internal failures. Then external failures. External failures, even detail we will discuss this again. Then external failure, cost associated with the fixing defects found after release. That means I am doing all the process, quality control or quality assurance department. It ever the mistake is till it reaches to the customer. It went to all the levels. So by mistake, it went to release to the market. It went to the market. Then what are the problems arises? Then how we are tackling that problem? What are the steps need to take? Then what is the procedure you need to follow? Some case, or you need to go and meet the authorities. Then travel expenses, tracking, and callback. Everything will come to the picture here. That cost is called as external failure. See, many people we came to know that. I think say we saw some paper advertisement. Some year manufactured car, they are callback, or only they may change the particular part and they are giving. So these are happening. Even drugs also happen. Thalidomide, the drugs, whatever available in the market, they can call back due to this producing the intoxicity to the pregnancy women. So this all will be happening. So then what are the steps you need into that? Then what is the cost you are spending to that? All come to the picture. This all called as poor quality. So 4 points here I presented. One is prevention, appraisal. Prevention is to prevent what are all the problems. For that, whatever you are spending is called as prevention. Then test, you need to test and ensure the product. What are the quality control tests you are performing? That is called as appraisal. These two are good cost quality. Then internal and failure come to the picture. These two are the poor cost quality. So the cost of poor quality, major cost involved in that. I think we saw that both the persons are telling that he is telling 65 to 70%. Wehenbecker, Juran's telling up to 20 to 40% is happening. So this what we need to understand that. Then prevention cost already I discussed. Then again I am telling you some valuable points. For exam point of view, I given here. This all you take it fine as a material and you read that. Product of service requirement. Establishment of specification for material, process, finished product and services. That is one point. Then quality planning. Creations plan for quality, then reliability, operations, protection and inspections. This called as quality planning. Then quality assurance, creation and maintain the quality system. This will help you to prevent the cost involved in the production of these things. As per the both the gurus says that only 5 to 10%, that is 5 to 10% we are going to utilize for prevention cost. For that we need to product or service requirement establishments. I think you build a specification for materials, processes, finished products and services. This all will help you to prevent the errors or plan mistakes happen in the process or steps or the every steps. Then quality planning. So when you are planning to this, then quality and reliability, reproducibility, productions you need to prepare. That will give you the quality products. The quality assurance. The quality assurance in the sense you need to take a product which is by the steps you are minimizing the error steps, then it will be produce a quality product. That product you need to assure the quality product is prepared by using this technology or terminology. This is the method we are following to produce a quality product. This all will come to the prevention cost. Then appraisal cost, as I already we discussed thing. Anyway, anything verifications. This includes the verifications, incoming materials. Incoming materials, thing you may know, every raw material, starting materials. That onwards you need to check. So as in the quality starting itself, I said how the material you are using, what is the material you are using, it will reflect your end product. So where is the quality materials you are procuring, that automatically a quality product you can able to manufacture. Quality product and quality process may produce quality product. That I clearly informed in the first class itself. So verification, checking of incoming material, that is raw material, process, setup and the products against agreed the specifications. That is whether it is meet out the specification or not, you need to test. So while here pharmaceutical industry, when you are preparing a product, you cannot go and check the product after finishing the product, because in process you need to check. While manufacturing a process, then you need to take some samples and analyze the samples and confirm that it is all specification meet out by the product. If final product, if you are taking any mistakes happen, you cannot be corrected. So in process, while going on the process, you need to check the verifications. When you are verifying the specification meet outs, then you can go for the further proceeding. Then quality audits, sometimes who I may prepare, then somebody from the industry or other industries or head authorities, HR departments, or some sister concerned or some regulatory bodies may come and correct it. They will check it that your quality audit systematically they will perform. So they will come and check your product quality, whether it is ensuring the quality concern or not. They will be checking. By checking that, they will correct it, whatever the steps you need to take it out periodically. Then sometimes randomly also they may come and audit. Then supplier rating, one of the very important thing. What is that appraisal cost? Based on the appraisal and assessment, they may code the grade to the suppliers. Whoever the suppliers of the raw materials they are supplying, you have to grade them by giving scores or terminology. Any terminology you can use. See, if 4 or 5 suppliers that you can grade them. Oh, this is a first supplier, this is a second supplier, third supplier, depending upon their quality products. Based on that, you can eliminate the very poor quality products that cannot be easily handle that situation. So because our wish to make a quality product for our product, so in that case the supplier also need to produce a quality product. So that is why the suppliers you need to ranking it. Then here, so one very important, how I can calculate the cost of quality involved in the steps. The COQ, I think this we are when COQ means it's a cost of good quality. Cost of good quality, that means involved in the sum of E. E means external failure cost plus internal failure cost plus appraisal cost plus prevention cost divided by sales. How much sales is happening into 100 will give that what is the cost involved in the quality product to produce. So this the steps equations involved in the cost of quality if I want to determine. That is, you can see 4 parameter we discussed, then one parameter newly it's coming here, sales. So depending upon customer satisfaction, sales will be come to the picture. So that is whatever the factors involved in this, all the 4 factors, you have to add all the 4 factors divided by, that is sum, divided by sales. How much product is sales in the market into 100% will give the percentage of how much quality product it is. Now, so we saw that what is meant by quality product. Now, what is the poor quality? The cost of poor quality, COPQ, is defined as the cost associated with providing poor quality products or services. Here, there good quality products and services. Here, poor quality product and services. This related to included of 2 category. That is, one is internal rejection or wastage, then external rejection and debits and claims. These are the 2 things are very essential. So then poor cost also 2 category we are dividing. One is called as internal, another one is called as external. What is meant by internal? You have to here think that internally we are rejecting or wastage happen while preparing. That is called as rejections. Then external rejections. External rejections, it is went to the market, the customer rejecting your product, then customer complaining your product, they are filing a case against you for failure products. These all come to the picture called as external rejections. So that there are 2 categories. One is internal, another one is external for poor management, poor cost factor involved. Here, internal failure cost. What is meant by the internal failure cost? I given here, I think easily to understand waste. First, the company may produce some waste materials. If I want to produce 10 kg of product, if I'm preparing 11 kg or 12 kg of things, that 2 kg considered as a waste material. So performance unnecessary work. So unnecessary. So one simple way is that I am doing plenty of process for that. That is also waste. The holding of stock in the long duration of period. So if I'm going to manufacture a product in the year 2024 December, if I'm purchasing now and holding, that is called as waste. To hold, then stock of result errors, the holding of stock errors, that is may happen many times. So without knowing that what is the product available in the stock, they may order one more time. So that huge amount may be present in that our stores. That is even it will be happening in our home. So sometimes we are purchasing 2 times in the same thing. Then we need to keep for 2 or 3 months to sale. Then we can go for further purchasing. So this happening here, waste management here. So poor organizations, the communications in between the stores or production department may not be quality, things will be there. So for example, here communication, the work order may be for 5-10 tablets they need to prepare. They may given the wrong information to the consumer, the stores. You purchase for 6 ton preparation, then 1 ton starting material will be a waste. It's as a lying in your stores, waste. That is called as waste. Sometimes the products may manufacture that may not be fulfill the specification by the in-house standards or regulatory bodies. What will be there? Then it will be waste material. So for example, one printing. So tablet, we are I think you may see in the tablet, alu pack will be there, aluminum packing. The tablet will be the in middle, that aluminum one side, aluminum one back side. They may crisp and compare. Both aluminum have doesn't any hole or any pore in between that. So then both aluminum are already predetermined printing happen. So if the printing errors happen, some print code is not coming properly, then you have to go for reprocessing. Then some air bubble is there without the tablet, it's packing. That is also problem may happen. This all that is called as waste material. Then second one is scrap. Scrap is the defective product material manufactured or produced that cannot be repaired. As I said already, I manufacture a tablet with a high binding agent. That is, it doesn't have a disintegration. The terminology I think many people know or not. Disintegration. This a large size particle is converted into smaller size particle. We are taking a tablet to produce a therapeutic activity. Then in the case that product will be go over the oral route of administration, it will reach to the systemic circulation, that they will be disintegrate and dissolve there. Then only that the absorption takes place and distribution, metabolism and excretion will come to the picture and produce the pharmacological action. But my tablet doesn't break or doesn't dissolve in the gastrointestinal fluid, it will be a waste. So that if failures in the testing of disintegration time, we found that we can't do anything once the tablet is prepared. So that will be thrown off. So that is the thing is, some things we are preparing, not repairable, reusables, you cannot sell, or maybe it's happening. I think you can see some products we are seeing in the market. Some companies' factory outlets will be there. There are minor problems of dress material will be available as a showroom, jeans or anything. Something they managed and they will be came to sold. They may reduce some cost of the things also, but that is different than our healthcare products. We cannot sell like our product like that. So if not fulfilling the requirement of certification, that will be waste one. That materials is called as scrap. If you think that some tons and tons tablets manufacturing and that not able to use, that is all scrap material. Sometimes the company may not be sustained in the society. That much problem may comes. Then another one is rework and rectification. Sometimes the rework is possible. Rework in the sense, So I prepared a tablet. By packing, the packing not completely packed or packing errors happen. That can be repacked. That is called as rework. So I can take a product again and I'll pack for rework. That is called as. Then failure analysis. Then I have to continuously check that what is the failure analysis happening in that. So then all the quality control parameters I have to utilize to analyze why this failure is happening. That cost related to this all called as internal failure cost. Internal failure cost. Then another part is external failure cost. What is meant by external? So that external, already I said that when it's went to beyond the industrial content, that means it reaches to the market. So before not able to correct the product, it went to the market, then it's happening. So it's happening that sometime the product may need to be repaired. But it's like a warranty guarantee we are giving. So that if before the warranty is any services happening, the company has to perform servicing. Sometimes they replace the product. So nowadays, I think you can see it's a complete warranty they are giving many places, unconditional warranty like that they are coming. So they can particularly they replace the product, not the service or repair the product. They replace the products. I think it's, now it's I think a wide range of advertisement coming for Yokohama tires. Yokohama tires, I think many people they are giving 5 years unconditional warranty. So that means within a span period of 5 years, if anything happened to your tires, they may take back and give you new tires. That things they are giving. So that sometimes you need to go to there, then repair you have to perform. See, I said that cars are given in the market, some suspension issue coming, then you need to call that vehicles only suspension you need to change, or their place you have to go and change, or you have to ask them to bring to your place. Normally that may not be, they may not come to your place, you need to go there and kind of service that. So these all will, what are the costs involved in that? This is called as external failure errors. Then another one is warranty claims, failed products. So if I am giving, I see that Yokohama tires, I said no, 5 years warranty they are giving. Warranty, 5 years replacement warranty given. So you consider that when it's not able to withstand 1.5 years. So 18 months that product is degrading. Then what is the things they have to do? They have to give new tires. So warranty failed to satisfy the warranty. So 5 years period we are giving is that quality should be very high standards to sustain up to 5 years. So that all will come to the picture. Whatever the spends we are make for this is called as external. Another one point is compliance. All the work and cost associated the handling of servicing the customer complaints. Many people see we are using household things. Many things we are purchasing. That complaints we are giving. So they are coming and servicing that in our home. Sometimes they may ask the product to send to some service centers. This both possible. What are the costs involved in that? That is called as complaints related to that. Sometimes you can see this servicing in your place, that they may take the service cost, they may involve, then you need to purchase a particular specific product. That is what is the failure happen. Sometimes it is possible that you consider in the pharmaceutical product it happened, have complaints, how it will be there it will be a harm. The if this is, since it is administering into the biological system, that is human being, we are administering to them. So when we are giving to the human being, whatever the problems comes, that is unwanted effect. Even it is harm or harmless to the particular patients, it is considered as a harm. So that we need to confirm the quality before come to the market. Even if come after confirming the product, it's come to the market, we be able to find out what are the spending happening related to that is called as external failure cost. Sometimes return, handling and investigation of rejected or recalled products, including transport cost. all come to the picture to see one BP apparatus. They are giving the doctor trust something. Doctor test, what they are telling, they are giving some 4 years period of time span. In between happen anything, you can return the products. Then you have to send them to them. Then they will send, identify the person where your address. They will send a person to pick up from your home. That whatever the transport involved in that, all they have to be. Both external will be a huge problem for poor cost quality. Poor cost quality. Okay, now why I have to calculate the cost? Now I said how to calculate the cost of quality involved in the production. Now, why I want to? What is the benefit I'm going to get? The reducing the cost of quality, we can reduce the production cost. So how I can reduce the cost of quality? That can be identified where I can able to produce the cost. I can reduce involve the quality. Then by reducing the production cost, that to design, provide alternate or cheapest method to ensure quality product. If you consider, so 8-step process I need to perform one product manufacturing, the same thing can be prepared by 2-step process. Very simple is there, means I need to accommodate that 2 process. Then 8-step may cost me very high. So that, like that, you need to design. Then control and take action of the gap what the available in between the things. That is I need to understand. So when I am planning for reducing the cost, then I can calculate the cost involved in that. When I will be that, because I need to sort out the gaps between the process where the control taken and action. What is the action I taken? So here the error coming. So how I am using to correct the process. That is the filling of gaps. Finally, increase the profit by reducing manufacturing cost. Every industry, every process, every organization will plan for this with minimum cost, the maximize the profit. That is the things. That is why we need to calculate the thing is how to reduce the COQ. That means cost of good quality or bad quality. Both the things you need to take into the consider. So I can reduce by give regular training to the workers, employees about quality and procedure. That is the first step involved in our organization. Whoever employees in periodically conduct the trainings, then continue education programs, then updating the knowledges, then brainstorming sessions, then discussions, all the things, trainings you need to give. The second thing is, then what is the trend is available current, then you have to follow that particular trend. What are the steps involved in that? Then what is the corrective actions I need to perform? That you need to follow. Then follow the 8D methodology to solve the problem. What is that 8D methodology? It's not in your syllabus. We can see if time permits, I'll take a class also. 8D methodology to solve the problems to improve the current conditions. So I can rectify the current position by various ideology. That is called as things. Then close corrective action loop. So wherever the corrections happenings, that can be appropriate place, you need to adapt it. Implement horizontal deployment. This is both together only. The implement horizontal deployment corrective and improvement action horizontally, in the sense, if you are taking one corrective measure in the one department, every department you need to incorporate. That is called as. Then train and improve the suppliers also. Whoever gives the material to you, for them also you need to give a trainings and improve them quality suggestion schemes and all the things. The last one is do kaizens continuously. Kaizens means a person introduce the simple terminology to follow the identify what is the corrective measures. So this is, I think, this case and technology I need to explain. If you want to one example, I'll tell you. If I am periodically in the library arrangements, if I am performing, you consider we are going to arrange uh, library books in the shelves. If I am arranging the books, after that I need to give some like a shadow or color code towards either a decline mode or increasing mode if I'm giving, then which book I can give the first, second, orderly can see by simple way without seeing the book number or material, what is the title and all the things. After arrangement of all the books correctly, you mark some like a arrow mark, either declined or inclined given means, then automatically by keeping the books easily you can identify. These are the steps. Kaizen technology they may call us. Kaizen in the sense the person name is called as Kaizen. Then another point, what is the benefits of controlling COQ? That is very, very essential. Here, by controlling the COQ, some points I can decrease, some point I can increase. What are the things I need to decrease? Defects, overall production cost, customer returns, customer complaints, customer claims and debits, the business threat due to the poor quality. This all I can minimize. Here, this taken into that both internal, external, all together. That is the benefits of controlling CO2. So everything, all the four factors I am taking into the consideration: prevention cost, then cost involving the appraisal, then internal failure, external failure, all put together. Some points I need to decrease, some points I need to increase. The defects, overall the products defects, then overall production cost, customer returns, customer complaints, customer claims and debits, then business threat due to the poor quality. What are the points I can increase? By this, I can increase the customer satisfaction, market share, that value, market value of your product, competitive edge. Competitive edge, I think you might English word, anyone knows. Competitive edge, what is the this gap between you and the next your competitor? What is your company position and all the things? What is the capacity? They enhance the capacity, so to, you can value you can make more by producing a quality products. Then sales, you can increase the sales. Then finally you can increase the profit. Here, this how I can manufacture, how I can utilize in the pharmaceutical industry. I may just a small recap. I will do the things. You consider a department, one tablet manufacturing unit. You consider. So, like if you want one example, I'll tell you that Cipla, they wanted to manufacture one product. The Cipla wanted to manufacture a product. Many departments involved in the production of any raw material, any products. So that means one institutional organization, those HR department will be there, stores will be there, production will be there, quality control, quality assurance, then HR will, then marketing will go. Then it's a cycle. This are the cycle will be working in that. When we are getting an order from somewhere, some offer to manufacture a product, that the process will be discussed to the production department and given the requirements to the stores. The stores will procure the materials. What is the materials they are procuring? We need to check by quality control department. What are the raw material come to the your industry? It will be stored in the store. That store you need to, before taking into the formulation, you need to perform whether it is satisfying the specific requirements. If it is fulfill that, it will be taken for the further process, or otherwise it will be in the quarantine. Quarantines they means then reject, they will return back to them. If the raw material is okay, if I am taking a product to manufacturing, while manufacturing, again the quality control department will come and check that product. In process quality control, while doing the process, we'll check the product. Then what are the specifications, which is meet out all the specifications or not, we need to confirm. Then it will be a second step. Once the second step also completed, then manufacture finished product. Again, the quality control department will go and take some samples and perform the check. If it is fulfilling, then it will be go for the packaging. That this fulfilling material database all consider taken by the quality assurance department. They will monitor the quality control department documentations. What are the samples they're taken? What is the sample result and all the things. Based on analyzing all the QC tools, they may certify that this product is allowed to market. That is QA passed, QA failed, or QA passed. QA passed, it will go to the packaging, then it is go to the market will come. If any product missed here, the quality checking, everything is quality, we are concerned. If anything, something missed out in the place, it will reaches to the market, that is will be called as external failures. Up to this prevention, then appraisal, then internal cost. Up to this, whatever happening in the industry, if premises alone is called as internal, up to this called as uh, internal failure cost. When it's when it come out into the market, then it is called as external failure cost. This we need to sort out these things. So this quality is very essential to produce a or profit as well as sustain into the market. These are the very vital point for the thing is, I think with this, the first chapter maybe I'll conclude, because it's all vast units. If possible, I'll try to explain one more time in the after completion. I need at least I plan to every chapter, first four chapter, four class. We'll see how it works. Any material you want, you can tell. Today, this material I shared with Professor Gobal sir for your convenience. He may give to you as a PowerPoint presentation. Thank you. We'll see in the next class. By second unit, I'll start. Thank you.
Sir, excuse me.
Sir, tell me, sir.
That cost of quality formula you said no.
Yes, sir.
Sum of E plus I plus A plus P divided by S. What is S, sir? In that?
Yes, it's sales. Sales.
Sales. Okay. Thank you, sir.
So, what is the sum of all the errors divided by sales into 100%?
Okay, sir. Thank you.
Okay, thank you. Thank you. Sir, anything you want, you can discuss anytime, sir. No issue. Anyone, I am telling. Anything related to materials or any discussion, anything. No? Thank you. I'm leaving.
Good afternoon. Good afternoon. Any participants, please respond. Good afternoon.
Good afternoon, sir.
Good afternoon. Is my voice audible?
Yes.
Is my slide visible?
Yes.
Yes, sir.
Is my slide changing?
Yes, sir.
Yes, sir.
Thank you. Thank you. So kind of you. Okay. Today, in the next 1 hour, we are going to deal about a topic, pharmacy services. In paper 17, under the subject hospital facilities management, in unit 1, there is pharmacy services. A pharmacist is an authority on medicine. He is the maker and messenger of medicine. He is a vital member of the healthcare team. So the pharmacist and his services, we are going to deal in detail now. The department of the hospital, which deals with procurement, storage, compounding, dispensing, manufacturing, testing, packaging, and distribution of drugs is called as hospital pharmacy. So in a hospital, as a hospital manager, you all need to have a thorough knowledge about the pharmacy services. So the pharmacy services start with procurement. There are many methods of procurement. You have one complete paper on procurement, that is purchase management and inventory control for hospitals. So under that, you will be learning that they call for quotations, and then there is a technical bid where the technical specifications of the product required by the hospital are verified. Then there is a financial bid where the lowest quotation is selected and then order is given. Nowadays, in central government and state government, all purchases are made through GEM portal. But in a private hospital, they will be having their own procurement rules. So once the drug is procured, the next most important step is storage. For vaccines and for the drugs that have to be stored in a refrigerator, cold chain will have to be maintained. In private hospitals, maintaining cold chain is very difficult. If cold chain is not maintained, the life of the vaccine is at stake. So maintaining cold chain is very, very important. In those days, we had compounding. I remember in Jipma, we used to have a very big pharmacy where cough syrups, ectamal glycerin, ointments, other syrups, they and all were compounded. The doctor would write the formula, the pharmacist would make it, and then it would be dispensed to the patient after counseling. So this compounding slowly got dispensed off with the entry of corporate drug giants. All drugs are now available on the shelf. So only dispensing with the counseling is being done. In many hospitals, they acquire manufacturing facility. So they test the drug. Once it is manufactured, whether it is as per the standard. So usually in India, we manufacture drugs as per Indian pharmacopoeia. If it is a foreign formulation, then international pharmacopoeia or extra pharmacopoeia. As per their states, in British, they have Britain pharmacopoeia. In America, they have the United States pharmacopoeia. So this testing is done as per the norms given in the pharmacopoeias. Then the drug is packed. Again, in those days, in a hospital, they used to ask the patient to come with the bottle and receive the syrups. But nowadays, the packing is there. The packing is tamper-proof. The packing is suitable for a hot climate like Rajasthan and for a very cold climate like Jammu and Kashmir and for a moist climate like Cherrapunji and for a mix of all like the South Indian states. So packaging is very important. And the distribution of drugs. Usually in a hospital, there will be a central pharmacy, and then in every ward, there will be satellite pharmacy. So drugs will have to be distributed in all these places. So this is called distribution of drugs. The pharmacy services, the first step is you should know about the types of pharmacy. What are all the types of pharmacy available? And then physical planning, how to plan for a pharmacy. And then staffing of pharmacy, what type of staffing pattern is required. Organizing a pharmacy, functions of pharmacy, intending, storage and distribution of pharmacy. So these and all are the pharmacy services that are being provided by the hospital to the patients. So these 6 pharmacy services will form the keyword to your answer. What are all the functions of a hospital pharmacy? First and foremost, the major duty of a hospital pharmacy is planning. So forecasting of demand, that is very important. In a rainy season, you will have to forecast that after a rain, most of the people will be suffering from cold, viral infections. And for the cold and viral infections, what type of medicine will be prescribed? Anti-allergic medicine, antibiotics, analgesics. So this has to be procured and kept ready in hand. So this is called forecasting of demand. So this forecasting is a very important function of the hospital pharmacy. And this becomes the first function of hospital pharmacy. Next is for the purpose of procurement, selection of reliable suppliers. There are reports that the drugs do not conform to the specifications. The drugs are contaminated. So we should be very cautious about the selection of reliable suppliers. Government gives a list of suppliers. The central government has come out with BPNI, which has floated the Jan Aushadhi, the generic medicine, Pradhan Mantri Jan Aushadhi store. Almost in all parts of India, we have this generic medicine store where the drugs are very cheap. So under this BPNI, they give the list of reliable suppliers. The Food Drug Administration, FDA, they also play a major role in ensuring that the suppliers are reliable. Next duty of a hospital pharmacy is to prescribe specifications of the required medicament. Many bitter drugs, the hospital requires that to mask the bitterness of the drug, that it is coated. Nowadays, in many hospitals, they give importance for sustained release medicine, whereby the number of doses can be reduced and the drug can be monitored. So such specifications of the required medicament has to be clearly given by a hospital pharmacy. In some hospital pharmacy, they have got their license for manufacturing sterile and non-sterile preparations. Manufacturing sterile preparations at a hospital setup is very difficult. Non-sterile preparations, comparatively easy. A hospital pharmacy will have to maintain the manufacturing records. So there are norms, there are specifications, there are models, there are guidelines given by the Food Drug Administration how to maintain the manufacturing batch records. In case if the hospital is not having a manufacturing unit, if they are buying it from a reliable supplier, then the hospital will have to ensure the quality of the purchased manufactured product. In many hospitals, they have a system where they take samples from the drug that is being procured, and these samples are sent to labs. They analyze them to ensure that if they comply with the label specifications. So this quality control is very essential because we are dealing with the life of the patients. Once the drug is procured and stored properly, distribution of the medicaments in the wards is very, very important. So this medicine has to be distributed to the wards. In the wards, the storage place is less. So the requirement will have to be exactly planned out and maybe for 3 days to 1 week, the requirement of medicine can be dispensed to the wards. In the wards and in the outpatient department, the medicaments are dispensed to the outpatients. So when the medicaments are dispensed to the outpatients based on the prescription given by the doctor, the pharmacist will have to ensure that it is the same medicine that is being given. The dose is explained to the patient, and how to store the medicament is also explained. Suppose if the medicament dose is over, how to get extra doses, what is the vehicle by which this medicine will have to be taken, all this have to be counseled to the outpatients. Drug information source in hospitals. Nowadays, many of the hospitals are teaching hospitals, and in teaching hospitals, they have a DIC, Drug Information Center. They call it as DIC. Any doctors who wishes to obtain information about a new drug, so they go to the Drug Information Center, and all information about new drugs are available. So the doctors keep themselves updated about the various new medicine formulations available in the market, and the patients also, in case if they have any doubts regarding the medicines that is being prescribed to them, they can go to the Drug Information Center and they can get the required information about the prescribed drugs. So drug information source in the hospital is very important. It has to be updated and it should be visible. Center for Drug Utilization Studies. There is one new subject called pharmacoeconomics that is blooming up. In many hospitals, they have this Center of Pharmacoeconomics, where the drug utilization pattern in the last year is being studied. The cost involved is worked out, and in the next year, how to get the best from the least cost, that is worked out. So the Center for Drug Utilization Studies is very important. Implement recommendations of the Pharmacy and Therapeutic Committee. So in every pharmacy, every hospital pharmacy, there will be 2 committees. One is called Pharmacy Committee, and another one is called Therapeutic Committee. So both these committees are very, very important. The Therapeutic Committee in those days used to come out with the publication of hospital formulary. So every hospital used to have a hospital formulary where the medicines prescribed by that hospital along with the specifications are given in a book form. So patient counseling. The patient counseling of late is again coming down, but the future of pharmacy lies in patient counseling. Giving a medicine as such is of no use to the pharmacist or to the patient. The pharmacist will have to provide counseling to the patient. The pharmacist will have to explain to the patient the details and specifications of the medicine. What is the name of the medicine? How to store the medicine? How to remove the medicine from the package? How to take the medicine? What to do in case if the patient skips the dose? All such details are given in patient counseling. The last and the most important function of hospital pharmacy is maintaining liaison between medical, nursing, and the patient. It is the nurse who is at the bedside of the patient, giving him the medicine. But it is the duty of the pharmacist to ensure that the medicine is available in the hands of the nurse so that he can give it to the patient. If the patient is ambulatory, that means if the patient can walk, so the medicine can be directly given to him. So in Tamil, we have a Saint Thiruvalluvar who has written a beautiful Tamil couplet. Utravan Tirpan Marundu Uraicelvan in Appar Narkutre Marundu. Utravan means patient. Tirpan means doctor. Marundu means medicine. Marundurai Chelvan means pharmacist. Appar Narkutre Marundu. These 4 people are the pillars of medical profession. Appar Narkutre Marundu. So 12,000 years back, Saint Thiruvalluvar has spoken about This pharmacy. So the pharmacist is a vital link between the doctor and the patient. The pharmacist is a vital link between the nurse and the patient. The pharmacist is a vital link between the paramedicals and the patient. So the patient information is passed on to the doctors, and the doctor's decision is carried forward by the patient, by the pharmacist. Next, we will see the functions of pharmacy. The objective of the functions of pharmacy is cost containment. This is called pharmacoeconomics. In a government hospital, the procurement is centralized. So the budget is drawn out. Money are allotted for the various drugs. So containing the cost, the best medicine in the lowest cost. Effective and efficient service. So initially, when the outpatient department is active, from morning 7:30 to 10:30, there will be a flow of outpatients. So these outpatients will have to be dispensed with the medicine. Counseling has to be given. The medicine will have to be packed and given to the patient. So these services will have to be very efficient and effective. Patient satisfaction is very important, especially in pharmacy services. The patient should have belief on the hospital pharmacy that the medicine given is of very good quality. So patient satisfaction is very important. Effective staff utilization. In case if the pharmacy is a 24-hour pharmacy, then 3 pharmacists are required. So their services must be optimally utilized. So if you look into the functions of pharmacy, the first one is the outpatient department. Next to the outpatient department, there will be a very big pharmacy. And inside the hospital, there will be an indoor pharmacy. There will be an emergency services of pharmacy. There will be a therapeutic committee which will monitor the therapeutic benefits of the drugs that are being prescribed. There is a training and research cell who trains the pharmacist. There is a quality control unit where the drugs procured, their quality are being tested. There is a procurement cell where based on the demand generated, the drugs are procured. Again, there is an independent authority that inspects the pharmacy, audits the drug availability. So all this comes under the functions of pharmacy. So there are 8 functions of pharmacy. That is why they call him as the 8-star pharmacy. Now we will define what is community pharmacy. Definitions are very important. They will have to be reproduced in the examination in the same words as it is given because it is a definition. Community pharmacy means any place under the direct supervision of a pharmacist where the practice of pharmacy occurs or where prescription orders are compounded and dispensed other than a hospital or a limited service pharmacy. The next one is hospital pharmacy. Hospital pharmacy is the organization or department of the hospital to manage the procurement, storage, preservation, packing, sterilizing, compounding, preparation, distribution of medicine in the hospital. So both these definitions are very important. So we will have to look into the physical planning of pharmacy. So if you look into the layout of pharmacy, the size of the pharmacy is very important. The lighting is very important. The preparation area in those days was very big and now it has become small. The location of the pharmacy service is very important. The storage area of the pharmacy is very important and finishing is very important. So we will look into the layout. There are 2 types of layout of pharmacy. One is called grid layout, what you see in malls. It is called grid layout. Products are displayed in straight and parallel lines. Next is free flow layout. Fixtures are irregularly shaped such as circle, arches and triangle, where just like in a branded showroom like Adidas, people walk around, enjoy and purchase. So that is called a free flow layout. So there are two types of layout in a pharmacy. We will see the layouts one by one. The first one is grid layout. Traditional form of store layout is grid layout. For ages, it is being like this, in which the counters and fixtures are placed in long rows or runs usually at right angles throughout the store. Usually in a hospital pharmacy, if you look into the dispensing counter, there will be a separate counter for male, separate counter for female. So the patients will be standing in queue in government hospitals to get the medicine for free. So there they use the grid layout. The most familiar example of the grid layout is a supermarket or a drugstore. The grid is a true shopping layout best used in retail environment in which majority of customers wish to shop the entire store. This is a grid design in a mall or in a shopping mall, where you can see that the long tables are arranged parallel to one another. Products are displayed and the salesperson helps us to purchase what we need. Next is the free flow layout. Fixtures and materials are grouped in free flow pattern on the sales floor. This layout is used in specialty stores like Reebok and Nike. Works best in small stores under 5,000 square feet in which customers wish to browse. Advantage: increased impulse buying. Disadvantage: possible confusion and waste of floor space. Usually in a hospital pharmacy, the patient doesn't have the liberty to choose the medicine. The medicine is prescribed by the doctor. So in such case, this free flow layout may not be beneficial. The location of the hospital pharmacy is very important. Usually in many hospitals, you can see that the pharmacy is located in the ground floor. The pharmacy has to be readily accessible. It should be near the steps, it should be near the escalator or the elevator. The pharmacy should be accessible to all areas of the hospital. The outpatient unit has to serve the outpatient department. In government hospitals, the outpatient department sometimes work for extended hours. So in such cases, the pharmacy will also have to work for extended hours. So the size of a pharmacy in a 100-bedded hospital is 10 square feet per bed. For a 200-bedded hospital, it is 6 square feet per bed. And for a 500-bedded hospital, it is 5 square feet per bed. Finishing. The floor should be very smooth, tough and resistant to acids and base. A heavy linoleum flooring is prepared. The wall should be smooth without any crevices, washable and light color. This will minimize the contamination. The drug cabinet, light colored, wooden or steel, has to be erected to store the medicine. Sterile solution room, waterproof room, smooth non-skid surface with the drainage system. They all have to be ensured and maintained. Arrangement of fixtures to be made in such a way that daylight can be used. So these and all are related to the wall. If you look into the light, the pharmacy should have abundant windows for natural daylight to enter. The windows should have mosquito nets to make dust-free ventilation. Venetian blinds can also be used. Fluorescence light on prescription and distribution area is very important. Lighting is to be clear for the patient to read the instructions and to know the medicine and how to take the medicine. Adequate electric sockets and exhaust for gas has to be provided. We will look into the prescription area. The prescription desk with cabinets and drawers. Sectional drawer cabinets with cupboard base. Desk, office equipment, computer, telephone. Drug information list and information board. So these and all are some of the basic requirements that are required to be installed in the prescription area. Preparation area. The work table for manufacturing of solutions. Empty adjustable glass storage shelves, sterilization facilities, standard counter heights, acid resistant tops, and acid proof sinks. So these and all are required in the preparation area. We will look into the storage area. The storage cabinet should have proper leveling. The space for loading of wooden packs, space for pharmacy lab with testing equipment, and equipment for compounding and dispensing should be available. Staffing. There should be a drug and therapeutic committee for advising and decision making. So 2 committees are very much essential. Then a chief pharmacist in hospital, more than 200 beds. 2 pharmacists are required for 100-bedded hospital. 3 pharmacists are required for 200-bedded hospitals, and 7 pharmacists are required for 500-bedded hospitals. We will see about the drug and therapeutic committee. So the medical superintendent of a hospital, we call him MS. He is the chairman. I will be back in a minute. Please wait. So for the drug and therapeutic committee, the medical superintendent is the chairman, and all the heads of the departments will be members. The nursing superintendent will be a member, and the chief pharmacist will be the member secretary. So what will this drug and therapeutic committee do? They will prepare the hospital drug formulary. Every hospital will come out with a hospital formulary. The hospital formulary will have the specifications of the drugs that will be prescribed in that hospital. So the selection of the manufacturer and supplier and mode of procurement will be decided by the drug and therapeutic committee. Addition of new drugs, deletion of old drugs in the hospital drug formulary will be made. Drugs will be supplied in the outpatient department. Policy formulation for pharmacy and monitoring. Budget demand for pharmacy. Developing drug information system. Checking of pharmacy records and drug quality. maintenance of drug standard and quality control, disposal of expiry drugs. So these and all are the functions of the drug therapeutic committee. So the functions are very responsible. Now we will see what are all the role of chief pharmacist. The chief pharmacist, his major role is implementation of the decisions of the therapeutic committee. So he will have to convene the therapeutic committee meeting regularly. He will have to prepare the minutes of the meeting. He will have to get the minutes approved. And he will have to present the action taken report in the next therapeutic committee meeting. Dispensing of drugs, pharmaceuticals and chemicals to different areas. So the duty of the chief pharmacist is to ensure that the medicine that is being procured is distributed to the wards, to the various satellite pharmacies as per their requirements. Maintenance of approved stock of emergency drugs and antidotes. In the newspaper, many times we hear that a person suffering from a dog bite, but antiretroviral drugs are not available. So maintenance of the stock in case of emergency, and especially maintaining the stock of antidotes. If a person is bitten by a snake, the snake antidote, venom, these are required. Dispensing of narcotic drugs and accounting. In cancer hospital, the use of narcotic drugs as a pain relieving agent will be high. So these narcotic drugs will have to be properly procured. They will have to be stored under double lock, double key system. So one key will be with the pharmacist and another one key will be with the medical superintendent. The accounting of the narcotic drugs, who supplied, what is the batch number, when was it supplied, how it is stored, who used it. So all details will have to be in the narcotic register. Specification for various fluids. Inspection of drugs at various point of use. So the chief pharmacist will have to inspect the satellite pharmacy. He will have to inspect the pharmacies in the ward. Preparation of intents, issue and receipt voucher. Inventory control. Maintenance of stores, ledgers and records. In case if there is a power failure, then the medicine that is being stored in the cold storage will have to be ensured that the alternate electrical supply is available to maintain the cold storage. Drugs, when they are procured, they are inspected for their quality control. It is the duty of the chief pharmacist to conduct teaching and training for the pharmacist under his control, and it should be a continuous pharmacy education. So the chief pharmacist will have to prepare a periodic utilization report of the pharmacy. He will also have to prepare patient charts for patient education. What are all the different records and registers that are maintained in a pharmacy? Number one, stock register for different groups of drugs. We have class C, class C1. So like this, there are a number of scheduled drugs. So for these scheduled drugs, we need to maintain stock registers for the different group of drugs. If anybody is requesting for a drug, then he will have to give an indent from the ward. The chief nurse will be giving an indent of the requirements of medicine to the central pharmacy and receive the medicine in the satellite pharmacy. So indenting and receipt voucher is very important. Regular drug inspection report has to be documented. Index registers and bin cards will have to be properly maintained. The medicine that is being issued to the patient, their expiry date will have to be checked. If there are any medicine that are stored after the expiry date, they should be disposed as per norms. If any patient reports adverse reactions, so the adverse reactions reported by the patient will have to be documented, and it has to be given to the pharmacovigilance committee. The file of correspondence with suppliers has to be properly maintained. Ledger account for payment of vouchers, the payment made to the procurers, has to be maintained. Condemnation record of non-consumables and consumables. So in every pharmacy, we have a dead stock register. So similarly, there will be a condemnation record of non-consumable and consumables. Annual stock verification record. So every year, at the end of the year, there will be a stock verification. So this annual stock verification record will have to be maintained. Every hospital will have to maintain a hospital formulary, and the hospital formulary will have to be updated. Every hospital will have to come out with an antibiotic policy. So what type of antibiotics they should prescribe. So all these records and registers will have to be maintained by the chief pharmacist. Now we will see about indenting of drugs. The hospital must have a laid down hospital formulary containing around 250 to 300 drugs. Modern management techniques like ABC, EED analysis will have to be applied. Drugs to be intended should be received, keeping the safety of the stock in mind. Economic order quantity to be followed to prevent overstocking or pilferage. So what is required, only that should be ordered. Order be issued as soon as critical level is reached. When the level of the drugs in the store comes down, so when it reaches the critical level, immediately the order should be placed. In case of imported drugs, sufficient lead time to be given. So in imported drugs, the time taken for the drug to travel from the foreign country to India has to be considered as a practical step. Receipt of drugs. All drugs received must be checked, weighed. The batch number has to be verified. The quantity has to be cross-checked. The date of expiry will have to be noted. Random sampling of each batch sample to be sent to the lab for quality testing to ensure the quality of the supplier. In case of any suspicion or substandard drugs, the drugs should be used only after the lab test. Sometime in emulsion, you can see that the emulsion would have been broken out. So in such cases, you'll have to send the sample to the lab report and wait for the report, and then only decision can be taken. There is one analysis called VED analysis. That is called Vital, Essential, Desirable Analysis. VED, Vital, Essential, Desirable. So this vital, essential, desirable is based on cost criteria. It helps to exercise selective control when confronted with large number of items. It rationalizes the number of orders, number of items, and reduces the inventory. So as per these analysis, 10% of the materials consumed, that is 70% of the resources, so when we are storing drugs, 4 types of storage are very important. Number 1, narcotic drugs. Narcotic drugs will have to be stored under double lock and key. General drugs will have to be stored under cool climate, dark. Inflammable drugs will have to be stored separately. There will be a sand bath, there will be fire extinguishers, there will be proper natural ventilation, and in that the inflammable drugs are stored. And last is the vaccines, they are stored as cold storage. So here the temperature will have to be maintained. So these 4 are very important with respect to the storage of drugs. Then is the general drugs. Drugs have to be arranged alphabetically in the cabinet. So that it will be easy to dispense. In some cases, they have the tablets arranged separately, capsules arranged separately, ointment separate, gel separate, powder separate. So based on the formulation, it is being separated. But among that, again, the medicines are arranged alphabetically because it is easy to arrange, easy to retrieve. PIN card shows stock position at any given period of time. What is the stock of the medicine available? Short expiry drugs has to be placed in the front and long expiry at the back. So usually they say first in, first out method is to be followed. The drugs to be used before date of expiry or transferred to other hospitals. There must be a constant watch on the expiry date, and if the expiry date is fast approaching, then the drug has to be used before the expiry date, and if it is anticipated that there is no use of the drug, then it can be transferred to other hospitals legally, following the legal procedure. In case if the drug is expired, then there is a procedure laid down for disposal of expiry drugs. So as per the procedure given by the Ministry of Environment, this procedure will have to be followed. Antibiotics, vitamins, liver extract should be stored in cold room between 15 to 20 degrees centigrade. The room has to be air conditioned with temperature control facility. Drugs like vaccine, sera, and hormones are stored between 2 to 8 degrees centigrade in deep freezer or walk-in cooler. So even in cold storage, there are 2 types required. One in cold room between 15 to 20 degrees centigrade, and another one in deep freezer between 2 to 8 degrees centigrade. The temperature will have to be monitored through dial thermometer and thermometer charting. So these both are very, very important. Now we will see narcotic drugs. Narcotic drugs must be separately stored. Special arrangements for narcotic drugs like morphine, pethidine, barbiturate have to be made. Proper recording of narcotic drugs has to be maintained. There will be even visit from the police department. Always narcotic drugs will have to be kept under double lock and for safety purpose and for avoiding misuse. Inflammable items. Those items that can catch fire, like for example, alcoholic products, solvent ether. Separate enclosures are to be made for flammable items like spirit, gases, chemicals. Adequate ventilation has to be provided for the inflammable item storage area. Firefighting equipments, fire extinguishers has to be installed in the right position in the storage area of inflammable items. The exhaust fans and the skyscrapers for the air to pass through, they all have to be maintained properly. We will now see the distribution of drugs. Drugs are distributed to various areas of the hospital like outpatient department, emergency department, and for that there is a three method of intending that is practiced. Number one is floor stock method. The drugs used for patient from the nurse's stock. 15 days intent is made to store. In stock out emergency intent is made. Disadvantage, drugs may or may not be available in store, delay in treatment. This is the floor stock method. The advantages and disadvantages we have seen. So here they keep a stock of 15 days requirement in the ward. This requirement is maintained by the nurse. Unit stock method. The medicines for each patient is packed separately as per the prescription, dispensed in one packet. Chances of pilferage is less, suits computerization. So this is the latest method. The next method is patient-specific drug order. A drug not available in stock, the prescription is written and sent for emergency intent in patient's name. Drug received, given to the specific patient. There may be delay in the medication. So this patient-specific drug order, especially now in government hospitals when the supply is less, so the patient himself goes and buys the medicine from other places and comes, but in a corporate hospital, the prescription is written, is sent to the emergency intent in the patient's name by the hospital pharmacy. Again, we will just recap what is the role of pharmacy. First is demand estimation. What is the demand? What is provisioning? What is purchasing? How much drug is received? When was inspection carried out? Quality testing, storage, distribution, they all come under this demand estimation. Next is compounding and manufacturing. Various kinds of fluids, sterile waters, mixtures, they are compounded and manufactured. Dispensing prescription to inpatients and outpatients as per the physician's prescription. Maintaining information on the quality, cost, supply of drugs and drug reaction. Investigation, you should investigate on the drugs, adverse drug reactions and the withdrawal of sample. Recently, you might have seen that one Digene syrup was withdrawn. Ensuring adherence to law, act and rules and regulations of drugs controller and applicable to storage and use. To promote economy in use of drugs, establish accounting procedures and utilization, strict implementation of policies and guidelines of therapeutic committee, assisting in training, teaching, research and drug trials, education of patients and relatives about drug use, maintaining proper receipt and utilization of storage record, periodic inspection by the chief medical officer in charge of pharmacy and drug controller. So these all are the roles of the pharmacy. Now we are going to see the problems faced by pharmacy. Very important. First problem is outdated drugs. Second problem is carrying of drugs. Third problem is pilferage. Fourth one, destruction by rats and insects. Sixth one, expiry drugs. Seventh one is storage cost. So the carrying cost or holding cost refers to the total cost of holding inventory. This cost includes warehousing costs such as rent, utilities, salaries, and financial costs such as opportunity cost and the inventory costs related to perishability, shrinking, and insurance. Here the keywords are carrying cost, storage cost, total cost, warehouse cost, financial cost, opportunity cost, and inventory cost. So these problems in a pharmacy will have to be addressed by working out modules, by regular inspection. Expiry drugs can be transferred or can be returned. By pharmacoeconomics method, storage cost and carrying cost can be calculated by the chief pharmacist. The Drug Therapeutic Monitoring Committee will take care of the outdated drugs. The inspection by the authorities of the Food Drug Administration, they will ensure that the drug storage area is free from insects and rats. And together, everybody will have to ensure that pilferage is not there. So with this, we complete hospital pharmacy. Next class, that is the continuing class, it's also my class. I'm going to deal about radiological hazards. Please bear with me for a few minutes till I start radiological hazards. We will take a small water break. Good afternoon. Any of the participants, please reply. Good afternoon.
Good afternoon, sir.
Thank you, madam. Am I audible? Is my slides visible?
Yes, sir.
Is my slides changing?
Yes.
Thank you. So kind of you. So today we are going to deal about radiation hazard. So this is a very difficult topic. This is a topic for the radiologist. But as a hospital manager, we will have to have a knowledge on this radiation hazard. Of late, the importance given to radiation hazard is increasing. In my class, we used to classify students into cellular and acellular. That means students who are having mobile phone, they are cellular, and the students who are not having mobile phone are acellular. The students who are not having mobile phone, acellular students, their number has come down and it is now 0. The students who are having cellular phone, on seeing the students, we understand that the name cell given to mobile phone is from the cellular jail in Andaman. The students have become prisoners to their mobile phones and they are exposed to a lot of radiation. So, radiation refers to tiny, invisible, or high-speed particles or high-energy electromagnetic wave energy that passes from one location to another and can have many manifestations. So this is the definition of radiation. So in your examination, you will have to write the definition in ditto. So radiation refers to tiny, invisible, or high-speed particles or high electromagnetic waves, energy that passes from one location to another and can have many manifestations. Types of radiation. Broadly, radiations can be classified into 2 types. Ionizing and non-ionizing radiations, particulate radiations. Ionizing and non-ionizing radiations, as the name says, they can be classified into 2 types, non-ionizing, ionizing. Particulate radiation can be classified into alpha particles and beta particles. So in the examination, if you write this definition and classification, they both will form the keywords and they will get you marks. Now, based on the sources of radiation, radiation can be classified into 2 types. Natural radiation. Natural radiation is again of 3 types. Type 1, terrestrial radiation. That means radiation from the earth. Terrestrial radiation. Cosmic radiation, radiation from the sun. Internal radiation, radioactive atoms that make small percentage of our body tissue. Now, this is natural. Next is man-made. The consumer products, air travel, nuclear fuel, atmospheric fallout, nuclear power plant accidents, medical radiations. So these and all are man-made radiations. Now we will see what is the definition of medical radiation exposure. There is one keyword which you will have to write in the examination, that is called ICRP, International Commission on Radiological Protection. So please remember this keyword, ICRP, International Commission on Radiological Protection. So this commission has defined the exposure to medical radiation in the following 3 categories. Number 1, exposure of individuals for diagnostics, X-ray, CT scan, NMR, interventional and therapeutic purposes. So cancer patients undergoing radiation therapy. Exposure incurred knowingly and willingly by individuals, helping either in hospital or at home in the support and comfort of patients undergoing diagnosis or treatment. The last one is exposure incurred by volunteers as a part of a program of biomedical research. So first one is for diagnostic, second one is voluntary, third one is for research. What are the sources of medical radiation exposure? Number one, radiography, X-ray, NMR. Next is radiation therapy. Radiation causes ionization of atoms. Atoms affect molecules. Molecules affect cells. Cells affect tissues. Tissues affect organs. Organs affect the whole body. We will go into a bit of history. On the right hand side, you are able to see Dr. Anthony Henry Becquerel. The unit of radiography, we call it in the name of Becquerel, BQ, in his name. He is keeping one hand on his chin with the sorrow that why did I invent this X-ray? The radiation was emitted by a naturally occurring uranium compound. Soon after radiation was discovered, its biological effects were found. Below you can see the photograph of the arm of Pierre Curie. In 19,000, he applied radium solution on his left arm and reported the subsequent changes of the skin, just like a burn. The ring shape on his arm is as he reported in his study due to the radium caused burn-like changes on the skin were later healed. Thus, the discovery of radiation itself exhibits that radiation triggers biological effects. Now we will see the radiation effect on the molecular or cellular level. Three types. They target the biological effects of radiation. They damage the DNA. They cause mutation. What happens to the tissue and organ? They are also affected. So, the radiation damages the DNA base. Initially, one strand is broken, and subsequently, the second strand is also broken. You can see in this diagram, whenever there is a radiation exposure to a cell, the DNA gets damaged. And when there is a DNA repair, it also leads to cell death. Synthesis of enzymes is altered. The normal cell function is altered. The second effect is mutation. Radiation just like chemical substances and viruses, has the ability to induce mutation. Mutation in somatic cells increase the risk of cancer. Mutation in reproductive cells increase the risk of cancer and may be transmitted to future generations as genetical effect. What is the effect of radiation on the human body? Harmful tissue reactions. That is called somatic effects. Acute effects, erythema, hair loss. Effects on the embryo and fetus, leading to mental retardation. Late effects like cataract, cancer, leukemia. Genetical effects, hereditary disorders and congenital abnormalities. What are the types of radiation damage? The types of radiation damage can be classified into two types. One is called as acute effect and another one is called as late effect. Acute effect, they appear at least 2 to 3 months of exposure. The causal relationship with radiation is easy to find in this type, like death, leukopenia, skin reactions. Late effects, late radiation damage, they appear after a long incubation period following exposure. The causal relationship with radiation is often difficult to find. Cancer, genetic effects, cataract, growth failure, and the like. What are the principles of cellular radiosensitivity? The principles of cellular radiosensitivity. In this, the keyword is law of Bergoni and Tribondio. So this law of Bergoni and Tribondio is very important. In your examination, this is a keyword which you will have to write. The law is very simple. Frequently dividing cells have a higher radiosensitivity. So the cells that divide frequently, like for example our hair, our nail, they are highly sensitive. They have a higher radiosensitivity. Cells with the ability to divide over a long period. First one is frequently dividing. Here cells with the ability to divide over a long period have a high radiosensitivity. But comparing to the cells that are frequently dividing, that is higher. Here it is high. Undifferentiated cells have a high radiosensitivity. So this is the law, very important law. Here you are seeing the cell cycle and radiation sensitivity. Radio sensitivity of cells differ depending on the phase of the cell cycle. This is referred to as cell cycle dependency. So we might have heard about lag phase, log phase, growth phase, exponential phase. So the early growth phase has low sensitivity. Late growth phase to early, they have high sensitivity. So the cell cycle and radio sensitivity, they go together. Now we will see the radiosensitivity of tissues and organs. So we have seen in the rule that when there is a high cell division frequency, then the sensitivity is very high. So thymus, spleen, the lymph tissues, they have the highest radiosensitivity. Next one is bone marrow. The third one is gonads, testis. Next to this comes the small intestinal epithelium, mucous membrane, skin epithelium, eye lens, hair follicles, capillaries. Medium sensitivity is kidney, liver, lung, and salivary glands. Low is thyroid, pancreas, adrenal gland, muscle, and connective tissue. The lowest is bone, fat, and nerves. So this is the radiosensitivity of the tissues and organs. Now, the keyword in your examination answer sheet is, what are all the radiation units? The first radiation unit is becquerel, named after the founder, BQ. Becquerel means how often does the decay of radioactive material occur? That radiation unit is becquerel. How severe are the health effects of that radiation? That is called as sievert, SV, sievert. How much energy is absorbed by the matter? That is called gray, GY. So there are three radiation units that we will have to mention. Number one is becquerel, BQ, sievert, SV, and gray, GY. What is the effect of radiation on organism and tissue level? There are two effects. One is called deterministic effect. Another one is called stochastic effect. Under stochastic effect, you get the carcinogenesis and genetic effect. We will see in detail each and every one of them. The biological effects of radiation are divided into deterministic effects and stochastic effects. For deterministic effects, there is a threshold dose. As the exposed dose increases, the seriousness increases. Excluding stochastic effects, all harmful tissue reactions and damage take place with the deterministic effects. Next is the stochastic effects. For stochastic effects, there is no threshold. As the exposed dose increases, the frequency of occurrence increases. What is the damage caused? Genetic influence and cancer. What are deterministic effects? Deterministic effects are caused by the cell death. Symptoms do not appear at the dose that does not cause a certain level of cell death. If the dose of radiation exposure is less than the threshold dose, it will not cause any damage. So it is safe. So you should know what is the threshold dose, and it should be always less than that. Examples: if it crosses the threshold dose, then the death of the individual, cataract, damage to the skin, damage to intestinal epithelial cells, damage to bone marrow, all this can occur. Now we will see stochastic effects. Stochastic effects are caused by mutant cells. If even one mutant cell appears, it may cause the effects of radiation. If the dose of radiation increases, the probability of effects also increases. Stochastic effects mean that even low level of radiation exposure do guarantee safety. Example, carcinogenesis and genetic influence. Here, we will see the effect of radiation on the gastrointestinal tract. The duodenum is the most sensitive radioactive sensitive part in the gastrointestinal tract. The crypt cells, the stem cells, the proliferating cells in the intestinal glands are specially sensitive to radiation. 10 gray or more of radiation exposure will stop proliferation of crypt cells, and as mature epithelial cells reach the end of their life, the submucosal tissues are exposed. Tissue damage by radiation causes dehydration due to diarrhea, bleeding, abdominal pains. If the damage is severe, it may also lead to death. Here, in this picture, you can see the normal mouse small intestine. When you give a 15 gray radiation, you can see how that intestine shrinks. The changes in the number of blood cells after irradiation. You can see that erythrocytes from the 7th day, they start reducing. Platelets from the 3rd day, granulocytes from the 2nd day, and lymphocytes from day 1, they start coming down. So the changes in the number of blood cells after irradiation is explained in this graph. The effects of radiation on gonads, testicles and ovaries. So if 0.15 gray of radiation exposure leads to temporary infertility, decrease in sperm count. 3.5 to 6 gray of acute radiation exposure leads to permanent infertility. Chronic exposure of 2 gray per year or more radiation causes permanent infertility. 1.5 gray of acute exposure causes temporary infertility and stops menstruation. 2.5 to 8 gray of acute radiation exposure leads to permanent infertility. We will see about radiation carcinogenesis. Mutations caused by exposure to radiation is the cause of radiation carcinogenesis. Back when the danger of radiation still was not recognized, many people succumbed to cancer due to the lack of knowledge and preparation against radiation hazards. Examples of radiation carcinogenesis in history. Skin cancer became a health hazard in X-ray bulb factory workers when they are exposed to a large amount of radiation in the process of their work. So when X-ray machine was invented, because of demand, X-ray bulb was manufactured in many places. The factory workers who are in this manufacturing of X-ray bulbs, statistically significant number of people were found to be suffering from skin cancer. There is a type of cancer called osteosarcoma. people who painted the clock faces with luminous paints containing radium suffered radiation exposure when they lit brushes. So in those days, to see the clock in the night, they used to paint the clock faces with radium paint. Accidentally, when this radium falls on their lips, so they were suffering from osteosarcoma. The people who are working in uranium mine, they inhaled radon by breathing and exposing their lungs to these rays. So they were found to suffer from lung cancer. There is one agent called thorotrast contrast agent. It contains dioxide thorium, which emits alpha rays, which leads to exposure, and people who are exposed to these rays suffer from liver cancer. What are all the genetic effects? Radiation damages DNA, causing mutation. Because mutations generated in germ cells, sperm and ova, can be passed on to the descendants. It is possible that the biological effects of radiation appear across generations. Animal experiments confirmed that mutation caused by radiation exposure can be passed on to descendants. How to protect ourselves from the radiation? This is very, very important. As a hospital manager, this is the part where we can act upon. The purpose of the radiation protection standard settings defined by the International Commission on Radiological Protection are: number one, prevent the occurrence of the deterministic effects of radiation. Number two, limit to an acceptable level the occurrence of the stochastic effects of radiation. Deterministic effects will have to be prevented. Stochastic effects will have to be brought down to acceptable level. So this both are the purpose of the standards set by International Commission on Radiological Protection. So this ICPR is a keyword. There are three principles of radiation protection. These are the keywords, very important: justification, optimization, and dose limitation. There must be a clear justification why you want to give this radiation. The radiation dose has to be optimized and the dose has to be limited. International Commission on Radiological Protection uses the following overall principles for all controllable exposure situations. Justification: no unnecessary use of radiation is permitted. First of all, is the use essential? Without this, can it not be done? So no unnecessary use of radiation is permitted, which means that the advantages must outweigh the disadvantages. So this is justification. You'll have to weigh and see what are all the advantages and disadvantages. The advantages must outweigh the disadvantages. If there are more advantages, then it can be done. Limitation: each individual must be protected against risk. that are far too large through individual radiation dose limits. So each and every individual has to be protected. The third one is optimization. Radiation doses should be kept as low as reasonably achievable. So this is called as ALARA. A as L low, A as reasonably, R achievable, A ALARA, as low as reasonably achievable. This is a keyword. You'll have to compulsorily maintain it. This means that it is not enough to remain under the radiation dose limits, but the radiation doses are as low as reasonably achievable, which often means much lower than the permitted limit. So please remember ALARA, as low as reasonably achievable. That is ALARA. First, we will see this justification one by one. A clinician makes decision reviewing the benefits and risks for diagnostic investigation to provide necessary information about the exposed individual. So this is called justification. Nowadays, the patients are getting learned information from the media. So they decide and they voluntarily expose themselves for diagnosis purpose to various levels of radiation. So here, unless and until a clinician makes decision reviewing the benefits and risks for diagnostic investigation to provide necessary information about the exposed individual, there are three levels of justification. The first level is called the general level. The use of radiation in medicine is accepted as doing more good than harm, because we need to save life. This is called as general level. The next one is called as generic level. Specific procedure with a specific objective, like for example, chest radiogram for patients showing relevant systems. So this is called the generic level. The third one is called as the application of the procedure to an individual. So this is the third level. So these three justifications has to be given before using this radiation. Now we will see what is dose limit. The dose limit is determined by the law based on the protection standards recommended by ICRP. This is not the boundary between safety and danger. The individual dose limit of radiation exposure. So the effective dose limit under this category, if the radiation worker is exposed to 100 MSV for 5 years, if the woman capable of childbearing, they are exposed to radiation, if the effective dose limit from conception to birth is 1 internal exposure, the effective dose is the dose converted assuming that the entire body has been exposed to the same amount as each organ or tissue. Uniformity in exposure. So this is called effective dose. Now what is equivalent dose? The dose of radiation exposure received by each organ or tissue. So you'll have to remove these two keywords, effective dose and equivalent dose. So what is the risk level due to radiation exposure? The risk level due to lifetime exposure is if a person is exposed for 10 SV per year, then the lifetime probability of death due to radiation is 1.8%. If it is increased to 10, then the percentage increases to 3.6. And the average loss of lifespan is 6 months. If the degree of radiation exposure is increased to 30, then 5.3%. If the degree of exposure is increased to 50, then 1 year and 1 month, that is 13 months of lifespan is lost. So now we will see the public exposure. The public exposure, the same risk assessment as occupational exposure. The risk level due to lifetime exposure. Lifetime probability of death due to radiation. The average loss of lifespan is 18 days. If it is 5, then the average loss of lifespan is in between 62 to 99 days. Now we are going to deal about a very important topic that is called optimization. Today in radiology, this is very important and it is saving the lives of people who are exposed to radiations. Here, the focus is to produce the best possible image quality at minimum risk to patients. So research has led to development, and today the instruments used in radiology, they are able to produce the best image quality at minimum risk to patients, keeping the radiation dose as low as reasonably achievable. ALARA. Economical and societal factors are taken into considerations. So this is a highly technical slide. So the radiographic technique used for optimizing is based on generators and filtrations, grids and image receptors, digital processing speed class, radiographic positioning and techniques, and quality control. For protecting the patient, we make use of patient shielding. In case if the patient is pregnant, then what should be the policy? And what is the guidelines for maintenance of this equipment? Personal protection is very important in case of radiology. Personal monitoring is very important. Personal dose measuring instrument is provided to each and every person. He will have to wear it on his coat and he will have to monitor the exposure to radiation. The use for gamma rays, X-rays, beta rays, and other strongly penetrating radiations. In this, there are two types. One is called as film badge dosimeter. The second one is called as thermoluminescent dosimeter. The cardinal principle in protecting a personnel is time, distance, and shielding. So this is a very important slide. In your examination, if there is a question on radiological hazard, please you will have to mention this cardinal principle. Minimize the time of exposure. With the help of sophisticated instruments, the exposure of the patient to the radiation has been minimized. Minimize the time of exposure. Double the distance between your body and the radiation source. So the distance has been doubled. This reduces the radiation exposure by a factor of 4. Shielding. Use absorber material such as plexiglass for beta particles and lead for X-rays and gamma rays. So in many cases in radiology, the radiologist or female, and they will have to spend a lot of time in the X-ray room. So the lead shield that they wear is very heavy. They will not be even able to carry it. So in many government institutions, this is what is being done. The workers are given a heavy lead apron, which they will find it very difficult to carry. So we will see the summary. The major DNA damage by radiation is of 3 types. The base damage, the single DNA strand breaking, the double DNA strand breaking. So this is a major DNA damage by radiation. The cellular tissue radiosensitivity. So this is the law of Bergoni. The law of Bergoni is very important. We have seen that 3 simple laws. Frequently dividing cells have a higher radiosensitivity. Remember, higher. Frequently dividing cells have the higher radiosensitivity. Cells with the ability to divide over a long period, they have a high radiosensitivity. And undifferentiated cells have a very high radiosensitivity. So this is called as the law of Bergoni. Next, the bone and the nerve cells and our fat, they are the least radiosensitive. The thyroid, the pancreas, the adrenaline, the muscle, the connective tissues, so they and all are medium. Similarly, kidney, liver, lung, and saliva, they are medium. But small intestine epithelium, islands, skin epithelium, bone marrow, lymphoid tissue, gonads, so they and all are the worst affected. Very important, we will have to remember the radiation units. The first unit is becquerel. How often does the decay of radioactive material occur? That is called as becquerel. How severe are the health effects? that is called as sievert, and how much energy is absorbed by matter. So that is called as gray. So remembering these 3 units is very, very important. Becquerel, sievert, and gray. Now, the effect of radiation on organism or tissue at that level can be broadly classified into 2 types: deterministic and stochastic. So we have seen that the gastrointestinal tract is worst affected. The deterministic effects are caused by the cell death as threshold dose. As dose increases, severity increases. Stochastic effects are caused by mutant cells. And they don't have a threshold dose. As the dose increases, the frequency of occurrence increases. Because of irradiation, there is change in the number of blood cells, erythrocytes, platelets, granulocytes, and lymphocytes. Radiation carcinogenesis. So people working in X-ray bulb factory, they suffer from skin cancer. People who painted the clocks with radium, they suffered from osteosarcoma. Miners who are working in the mines, in uranium mine, they were exposed to lung cancer. And similarly, the thorough contrast agent containing thorium dioxide are prone for liver cancer. So we have seen how to protect ourselves from the radiation. We have to prevent the occurrence of deterministic effect, and we have to limit the acceptable level of occurrence of the stochastic effect of radiation. So for preventing radiation, we have to follow the 3 principles: justification, optimization, and dose limitation. So justification means no unnecessary use of radiation is permitted, which means that the advantages must outweigh the disadvantages. Limitation means each individual must be protected against risks that are far too large through individual radiation dose limits. In optimization, we saw this acronym ALARA: as low as reasonably achievable. As low as reasonably achievable. So radiation dose must be kept as low as reasonably achievable. ALARA. Then in justification, we saw the 3 levels of justification: the general level, the generic level, and the 3rd level. Then the individual dose limit of radiation exposure. That also we saw. We saw about the effective dose and equivalent dose. The risk level due to lifetime exposure. So this has been calculated. And if there is exposure of 50 MSV per year, then a person loses 1 year and 1 month. Then we were seeing about optimization. So the focus is to produce the best possible image quality at minimum risk to patients, keeping the radiation dose as low as reasonably achievable, ALARA, economic and societal factors being taken into consideration. And for optimization, a lot of modern techniques have come up. So protecting the patient with the help of patient shield, protection of the pregnant woman, and the guidelines for the purchase of radiological equipments. The personal dose measuring instrument, film badge dosimeter and thermoluminescent dosimeter. These both are the common types. They have to be worn by the people, by the radiologist. And for protecting a personnel, the cardinal principle is time, distance, and shielding. The time of exposure must be the minimum. The distance between your body and the radiation source must be double. And shielding, like using of lead aprons and plexiglass. This is very important. So all these points we have seen in radiological hazards. So it's a bit tough subject, but it is very important of late. So with this, we complete radiological hazards. If anybody has any doubts, you can ask me. So this is a 15 days personal contact program. In this program, we will be dealing 5 subjects. MBHM 4001, 2, 3, 4, 5. So the purchase management and inventory control for hospitals. This entire paper is dealt by Professor Dr. Reddy. Hospital facilities management. So this is dealt by a wide variety of people. Like we have a pharmacist, we have a professor on hospital pharmacy, we have a doctor, we have a scientist. So they all deal this paper, hospital facilities management. Hospital information system. So that is dealt by engineers. So we have engineers from PTU and from Sri Manakula Vinayagar College of Engineering. They deal with this subject, hospital information system. Total quality management is dealt by a quality assessee, Dr. Venkatesan and Professor Dr. Mohanta, Guru Prasad Mohanta. They both deal the total quality management. And public health system and outreach program. So that is again dealt by the people who are in the field. So these 5 papers are being dealt in this personal contact program. Along with that, the guidelines for project work will also be given. So I'm sorry. In case if you have any doubts, you can ask me or we can wind up. I thank you for your patient listening and for your active participation. Thank you very much. I wish you all the best. Study well and come up in flying colors. If there are no more questions, then we can wind it up. Thank you, thank you, thank you very much.